Good afternoon, members, and to those here present. It is now 1:37 p.m., Friday, April 28th, and I hereby call this joint committee meeting to order. This is a joint committee between the Senate Health, Education, and Welfare Committee and the Public Utilities, Transportation, and Communications Committee. I am the chair for the HEW. Senator Paul is the chair for PUTC. And to introduce the members present here today, under the Health, Education, and Welfare, we have Senator Dennis Mendiola, Senator Frank Cruz, Vice Chair Karina Magofnia, and myself. And with 4 members present, that constitutes a quorum for that committee. Under the PUTC, we have Senator Paul as chair, Senator Karina Magofnia, myself, Senator Jude, and Senator Frank Cruz, and that constitutes a quorum for PUTC. Also joining the committee is Senate President Edith De Leon Guerrero. And with that, members, can I get a motion for the adoption of today's agenda? All right, motion was made and seconded. Discussion? All those in favor say aye. All opposed say nay. Motion carries. And also want to recognize the presence of Senator Selena Valta. She is a member of both HEW and PUTC. All right, next item on the agenda is public comments. If there's anyone in the public that wishes to make a comment, floor is open. All right, and it looks like there's none, so public comment is hereby closed. And we move on to new business. Up for discussion is miscellaneous communication 23-23, CUC to CHCC demand for payment. And this is a letter with the subject disconnection notice and demand for payment by the then acting executive director, Dr. Peavy. I'm demanding for payment to CHCC with a deadline of May 4th. Otherwise, services will be terminated. And so we're here to hear from both sides, from CHCC as well as CUC, in regards to the history of the billings and the understanding of what agreements were in place then and now, and what are some recommendations moving forward. The floor will be open to the members to get any clarifying questions. And then again, as stated prior to coming on, prior to convening, the members will then have the opportunity to discuss possible solutions, including, I believe, a bill that is sitting committee, if that is something that we could act on to address the current situation. So without further ado, I'd like to invite right now CHCC CEO, Dr. Munya, with her team to join us in the chamber. Can you help? I think you got a presentation. Can you help them hook up to the screen? Dr. Munya, will you still be making the presentation as requested? Yeah.
Chair, I would go ahead and do the opening statement while the link is.
Sorry. Yes. Please go ahead, Dr. Munya.
Thank you again, chairs of both committees, and I appreciate for this invitation to present to you today. The fiscal crisis concerns the unpaid balance owed by the government agencies to CUC was described by OPA report AR 17-02 as an event created by a lack of historical appropriations by governors and the legislature to support the public school system and the Commonwealth Healthcare Corporation. Unquote, I'm sorry. In December 2016, with the support of the governor, funding from the Casino Community Benefit Fund was given to CHCC, where CHCC paid CUC $7 million. In July 2020, the government paid $2.5 million to CHCC from ARPA funds. Nevertheless, CUC disconnected the CHCC beginning September 8, 2020. Despite CHC and then during this time we were responding to a public health emergency. Nevertheless, an agreement was executed to pay CUC $219,000, $150,000 or more from CNMI, and $69,000 from CHCC. There were also laws passed by this body. Public Law 20-11 requires public corporations and other autonomous agencies to pay 1% of the total operations for FY 2019, which was estimated to be approximately $1.563 million for the payment of CHCC's past utility bills. Unfortunately, none of those funds were applied to CHC's debt to CUC. Public Law 1871 appropriated $3.2 million to the outstanding debt of CHCC to the public utility. This amount was also not credited despite being paid. It is clear that since health is the responsibility of the government, the CNMI government provided assistance to CHCC to assist with utility expenses. These are utility expenses provided for you and your family's healthcare needs. In budget hearings, we've emphasized that subsidy is essential to helping us meet our obligations to this community of ours. However, as the audit reports, the lack of historical appropriation is a factor of why we are here now. As we explained to CUC yesterday, if we are expected to continue to pay the government rate without government help and subsidy, then patient care will be affected and hard decisions will be made that will result in CHCC losing certification and ultimately losing its biggest payer source of Medicare and Medicaid, which we know the government cannot be the option. If we are to be disconnected, the most rational choice that ensures we continue to receive Medicare and Medicaid funding is to get off the grid and stop the bullying and scare tactics and ensure that we meet certification and still provide quality care that our people deserve. I cannot say no to patients requesting a $25,000 treatment a week because I have to do the impossible and pay CUC, a government entity which also the government supports. And I cannot imagine what will happen when the Medicaid PE ends or when the funding for Medicaid is exhausted and patients will all be directed to CHCC, a safety net provider, because we can't and we won't reject patients who need care. While we couldn't pay over the years, the amount that we're offering CUC is a result of working long hours together with Medicaid to adjust the rate of reimbursement owed to CHCC. There is still a lot of work ahead of us to properly get reimbursed, but we're not unique. Hospitals across the country have challenges that jeopardize access to care and services for patients. There are not enough caregivers. Significant underpayment by Medicare and Medicaid is felt everywhere, and there are soaring costs of providing care. Low payments with these soaring costs. What we're doing is trying to stabilize finances, even with these factors, by building local capacity and strengthening our health system to ensure that there is a pipeline of healthcare workers for our fragile community. We will continue to lobby for parity and Medicaid funding, and we can't ignore that the rate we're being billed for goes beyond other healthcare providers. If CHCC is determined to can't pay this exorbitant rate, then why is there no room to negotiate? And why is there no room to fix it? We need this body to help. If neither CHCC nor CNMI is determined to not have the funds, then help us with the changing of the rate for CHCC and removing the arrears of unfair rates. Thank you.
Thank you, CEO Munya. At this time, we'll allow your team to go on and make the presentation now that it's up on our screens.
Thank you, members of the Senate, for having us today. My name is Caitlin Isis-Mokanu. I'm the Chief Strategy Officer at the Commonwealth Healthcare Corporation. This issue has been going on for, since the inception of the CHCC, so more than a decade. So we started looking into, what is the core, what is going on here as far as what the cost and the rates. So I just wanted to show you some of the numbers on the government rate versus commercial. The theory or the logic behind that and what the effect of that inflated government rate is, and then also go through what the impact of that is on the CHCC's arrears, and then just briefly explain Medicaid reimbursement to the CHCC. So we can go through the next slide and the one after that. So I wanted to start off with the electric charges. You can see in commercial, the commercial rate is in blue and the government rate is in orange. This is about a 10% higher amount per kilowatt hour for over 1,201 kilowatt hours. Next slide, please. And here are the water charges. This is per 1,000 gallons. And for water charges specifically, the rates for the commercial sector vary based on volume, but for government, it doesn't matter if you use 1 gallon or 60,000. So the government rate for water is $54.30 per 1,000 gallons, and the commercial rate for that same amount is $4.49. You can see a pretty significant difference there. Next slide, please. And here's wastewater sewer charges. For the government pays $68 for every 1,000 gallons. And the commercial sector, which includes resorts, very high utilization water users, are paying $3.13 per 1,000 gallons. And these, you should have, the committee chair should have received a packet of information. All of this is in greater detail in that packet. Next slide, please. So just to walk us through this logic model of having an inflated government rate. I mean, if the government's expected to pay a higher rate to cover utility costs, that in theory would avoid increases to the commercial and residential sectors, right? And those sectors do pay taxes and fund the government, right? In addition to grants. So in theory, the government's expected to pay more in order to reduce the likelihood that increases happen, to the other sectors. Next slide, please. Here's the reality of what's happening. So because the government, the CHCC and the central government, other government agencies cannot afford the inflated rate, and there's a dislike for increasing taxes to cover that cost. The CUC can't cover their costs. That bad debt is factored into the FAC, which then increases the electricity charges for everyone, including the government. So it's kind of a broken model. It's not working well. Next slide, please. And this goes into utility rate classification, which in the packet, you'll see a very detailed history of how this happened. It started in 2010, or there seemed to be some lawsuit before that about a high government rate. But based on the packet information that we sent you all, it started in 2010. And the classification in the CNMI of utilities seems to be unique from other classifications for rate making elsewhere in the world. Typically, demand separates customer classes. So industrial, commercial, residential, based on demand. But in the CNMI, we are unique in many ways, and this is one of them. We have classes for residential, commercial, government, and nonprofit. So whereas diversity and demand ought to distinguish the customer classes, in the CNMI, we have organizational differences, which distinguishes customers. So for example, the CHCC consumes much more energy, power, water, wastewater than the Department of Commerce, but we are paid the same rate because organizationally we are all government. So that is a unique thing about the CNMI. And there is some mystery around how that came about. As you'll see in the packet, it's all explained as to, there's not much documentation as to the reason for an inflated government rate, especially for water and wastewater, as you saw earlier. So how does this affect the CHCC? Next slide, please. Here are our arrears, as you've seen in the paper. It's a large amount, $54 million. But what happens when we take away the penalties? So the penalties for water, wastewater, and electricity are quite severe. There's 1% charge every month. I think there's different rates for different 1%. And then one of them is compounded monthly, one of them is compounded yearly. But then the interest actually goes to the principal. So there's interest upon interest every month. So those penalties can accumulate quite quickly. So if we look at the next slide, we can see what happens when we take those late fees away, down to $32 million. And what happens when the CHCC would be treated as a commercial consumer? In the next slide, we can see that, down to $8 million. So we have a discrepancy from $54 million roughly to $8 million, depending on how the CHCC is classified, how we are charged, for late fees. And because of the high rate, obviously there's late fees involved. So you can see how this can get complicated quickly. And on a last note, I just wanted to, we have, next slide, please. We have a lot of debtors ourselves, so this isn't just like passing the buck, but just demonstrating one of the largest debts that we have is the local match, or the lack of the local match for Medicaid. Since the inception of the CHCC, we have borne additional costs of about $91 million, which have not been reimbursed in the Medicaid local share. So we're able to draw down the federal and use our own costs as the local share, but then that is never reimbursed by the CNMI government, or very rarely. There was one time in 2013, I should clarify, one time in 2013, there was an appropriation made for the local share of Medicaid. So you can see that the numbers drop in FY19, 2021. This was due to congressional action, due to U2, COVID, et cetera, increasing the federal share. So when the federal share goes up, that's great news for the CHCC. That means we will get a higher reimbursement. So this is one of the reasons why we now feel like we can afford the commercial rate, at least for utilities, because of this federal increase. And that is all from me. Thank you so much.
Thank you, Ms. Caitlin. So what is the total local share that is owed?
$91 million.
91?
If we're counting from 2012.
Since 2012. And earlier you mentioned there were two public laws that were to address CHCC's utilities.
The local match. Oh, the utilities. Oh, yes.
2011 and 1871. 1.56 and 3.2. That went directly to CUC? But they never credited your account? Is that what I'm understanding?
Only the 3.5.
Eventually.
Yeah, only the 3.5 came directly to CUC but was not credited to our account. The other was OPA share, OPA percentage that were appropriated to pay CHCC debt to CUC instead of given to OPA. But the 3.5 is payment directly made by the CNMI treasurer. The CMMI treasurer confirmed that the transfer was made to CUC, but we never see that credit in our account.
So where did that money go?
To CUC.
No, I mean, whose account did that get applied to? You don't know. It wasn't CHCC, definitely. Is that what you're saying? And how much does CHC utilizes in a month in utilities?
I don't have the kilowatt hour in my head, but I know our average monthly bill at commercial rate is around 500,000 now.
You said at commercial rate.
Sorry, at government rate is around 500,000.
500,000 utility power
Power,
and
water, and
water.
sewer.
What's the cost to get off the grid monthly?
We're working on that, but it's, we're expecting about 200,000.
monthly, correct? And from my understanding, there you did write to CAUC board proposing a monthly payment. Can you say for the record how much is CHCC able to pay each month?
We were proposing to pay 225,000 each month. That is approximately our electric bill. We were intending to dispute water and sewer, so we were offering to pay our electric bill monthly, approximately 225,000 a month, so that our power will not be disconnected.
So you propose to pay current billings, but haven't really addressed the arrears,
Yes.
correct? Have you come up with any proposal as to how you will address the arrears pending any action by the legislature?
No, because at this moment we are at a deficit. We're trying to do rate adjustments with Medicaid to recover some of the costs to keep our vendors current. We have to prioritize, like Esther Munya was explaining, CEO Munya was explaining. There is a difficult decision to make, and we choose to buy pharmaceuticals, which cost us about 300,000 weekly to be able to keep our patients getting treatment, the medication they need.
Thank you. And sorry, just for the record, can you please identify yourself? I know who you are, but for those tuning in.
Good afternoon. I'm Perlita Santos, CHCC CFO.
Thank you, Ms. Santos. Did the CAUC respond to your letter? And what is the outcome of?
The outcome is that, that they will proceed with the disconnection, and that, they will, they're asking for actually 500,000 plus 225, so 700,000 a month.
The proposal is 725 a
About
month.
725 a month.
Okay, I would yield for now to any of the members that have questions. I recognize Madam President.
Thank you, Chairman. I understand you talk about paying your monthly billing from current forward to make sure that your power does not get disconnected. But you do plan to dispute your water and sewer charges, and that you do have arrears that also needs to be resolved. What is your total arrears to date?
32 million
32 million.
principal.
Okay, now I understand on the PowerPoint it talks about a $91 million due that COC has borne the additional cost due to no local Medicaid share, right, has not been received. If you could share with this committee, how is the hospital, I know you mentioned earlier about being in deficit, but considering that you have a 91 million receivable that have yet to be received from Medicaid, and you borne these costs to continue the facility services, what particular revenue sources are you guys tapping into to maintain operations, considering that the magnitude of $91 million since 2012 allows you to stay afloat despite what you're stating today as operating on a deficit? I'm really curious to understand that.
So management has opted to defer payments to related party. We have not remitted in the Chapter 2, Chapter 7 taxes, and we have not paid CUC. So those are the most significant accounts that we are not remitting.
Hold your thought on that. Did you mention Chapter 2 and Chapter 7 taxes?
Yes,
Are those employee withholding taxes?
yes.
So your remittance to
central government.
your employees withholding taxes are withheld by CHCC to ensure your flotation of your operations. And that would be owed basically to the central government in a sense, where the books will balance out itself. And every year we issue tax refunds to individuals as they file their 1040 CM taxes. And so with that, what would be the amount of Chapter 2, Chapter 7 taxes that are not remitted to the local revenue and taxation? And I'm gonna insert if you're also withholding your FICA taxes and your Medicaid taxes.
We are remitting 100% the US taxes. We are only withholding our related party taxes as offset to the related party obligation.
Thank you for stating that, because if somebody was to retire today, you might be in trouble
Yes, ma'am.
for withholding the FICA taxes and Medicare taxes. And so but I'm still going to go back to Chapter 2 and Chapter 7, and whether in your books have you taken those amounts and offset what you would have been expecting with respect to your $91 million overdue
Yeah,
from
so-
Medicaid as you're adjusting entries in your books
Yes.
to move you forward so that you have paper money on your books
Yes.
that you continue to spend on while waiting to realize the $91 million from Medicaid.
Yes.
If you understand what I'm talking
Yes,
about, right?
yeah.
Thank you.
Yes.
May I add one more thing? So for management to make sure that the hospitals stay afloat, there are delays, even though we prepare a budget every year. There are decisions that have to be made that have to be delayed, for example, depending on the cash position that we're in. And yeah, so that I just wanted to add that.
Go ahead, Madam President.
Mr. Chairman, this is very important, and I appreciate you being transparent with us today, because when every year we deliberate the budget of the Commonwealth and we look at all the tax revenue resources that we collect, which includes employer taxes, withholdings of Chapter 2 and Chapter 7, and it really puts us now in a deeper situation where we need to conduct more analyses of revenue collections of the Commonwealth, including those that are working for independent autonomous agencies of the Commonwealth government, so that we could parallel the mathematical non-collection of Chapter 2, Chapter 7 taxes that are being withheld from submission to the local revenue and tax when they report their overall general revenue collections of the Commonwealth. And so if you please could provide us that number of how much withholding on Chapter 2, Chapter 7 to date that is still appearing on your books that has not been remitted to the local revenue and tax. Thank you.
Thank you, Madam President. I think just to clarify, again, the 91 is central government owed to CHCC because CHCC is the one that covers the local share if the central government does not remit, correct? Yes. And, well, for now, I'll recognize the vice chair.
Thank you, Chairman. And just in the same line of questions that Senator Edith had asked, first and foremost is the practice of holding the tax withholdings even legal?
No, it's not. But we have a valid receivable from the CNMI government to offset it with, being related party. Had we been private, we should be put to jail already. But since we have a valid CNMI accounts payable that is more than the amount we owe, we are holding it to offset this because our cost, which is used to match our cost, our CNMI, CHCC cost, which is used to match Medicaid so that the CNMI could benefit from the Medicaid program, is our expenses. If we do not withhold those Chapter 2 and Chapter 7, those would be essentially unfunded match, which would be questioned by Medicaid. Why are you using an unfunded match as a cost? Then we would not be entitled for the Medicaid federal match.
Right.
So what we are doing here is making that, by withholding that amount, recording it as a payable to the government, at the same time recording an equivalent amount as receivable from the government, we are making the Medicaid local share funded somewhat so that we will not jeopardize the entire CNMI Medicaid benefiting from the federal match.
So I understand the rationale, and logically it makes sense, right? But I'm looking at it from a legal standpoint, and I mean, what does your legal counsel say about that practice?
So there has been discussions with former secretaries of finance, from Larissa Larson to Secretary Atalig, that there is going to be some decisions that have to be made, and they understand that there has to be an offset.
Right.
Yeah,
And that's internal, right?
right,
But
right.
have you guys sought like the AG's opinion about this? Because this is some very serious consequences, especially for the employees who file their tax returns. They are waiting on those withholdings for tax reimbursement. So I'm just
So far to date, our employers have been receiving their taxes because the previous secretaries have agreed to the offset, because it is for the greater good of the entire CNMI Medicaid to allow for the offset, rather than it would be the same. The government should write us a check and we issue back the check to the central government. It's just a wash. In fact, we're still owed more than that because yeah, I do not have the exact amount in top of my head, but 91 million owed to us is still greater than our CUC with arrears plus the chapter 2 chapter 7 combined.
but you're saying that you've been withholding the tax withholdings of chapter 2 and chapter 7, which means you have not been remitting those taxes to revenue and tax. So therefore, when the employees file their tax returns, those amounts wouldn't even show at revenue and tax because you haven't remitted the payments.
Because of the previous agreements with the previous secretaries, all our employees have been getting their rebate. None of our employees have not received their rebate because there is that understanding of the offset.
So I would just assume that the books on the revenue and tax side are also reconciled with finance,
Yes.
since they're all actually already paying it without recording those
Yeah, they're-
on the revenue and tax side
Yeah,
books.
so the CNMI, the revenue and tax, always confirms a receivable from us as well for that amount. So it's recorded there as receivable and payable, and it's recorded to us as payable and receivable. So eventually, in the consolidated CNMI financial statement, that would wash out and not have an impact. So yeah.
Okay. I'm very, very surprised to hear that kind of practice, because this is definitely not in compliance with GAAP. And so I'm just putting it out there. But moving along. All right. So is there still tax withholdings that CHCC is withholding and not remitting? How much is that? And for which years are you withholding?
I will send the detailed schedule to the
Okay.
the
That would be
committees.
that would be great. Now, I would like to get a better understanding on the root cause of why we are here now. And obviously, part of that root cause is the inability for CHCC to pay its financial obligation to CUC. And one of that is, I would like to know, uh, what is the process for CHCC's billing and collections? Because this would kind of help us understand, right, the financial condition that you guys are in. So can you just share with the members what the billing and collection process is?
So it is before I go into the details of billing and collection, it is important to note the payer mix.
Right.
So of our patient payer mix, about 70% are Medicaid and Medicaid PE. And for that, we only get the federal match. That is a significant amount of unfunded cost, because we are not able to charge a margin for that. We don't add markup to that. For our Medicaid and Medicare patients, we are only reimbursed that cost, no margin. And then for our insurance, those are the ones that where we process, we code and bill for the insured. And then for the uninsured, we code and bill for those as well. But then we had, with limited personnel, because we have a significant unfunded operation, we have to prioritize which transactions to bill and code, to prioritize which transaction to bill and code. And having said that, we prioritize billing and coding for third-party insurance, Aetna, Take Care, so those. And then when they pay and then they return the bill and do an explanation of benefits and there's a patient copay, then we bill the patient for that.
Let me just add. So the process is basically is where the cash cow is, right? Exactly. So the cash cow is Medicaid, Medicare, and Aetna insurance, and some private insurances, but not those are, even though there is a law that requires that they pay within 30 days, we still have challenges with those private insurance companies. But so our focus really is Medicaid. And as we, since 2020, we have had an increase in volume with Medicaid presumptive eligibility. And that has made a significant delay in the processing of these claims. There's also the professional side. There is Medicaid right now reimburses us at cost for hospital, but in regards to professional services and even for Tinian and Rhoda, they have to be billed individually versus using the Medicare hospital costs. And that, again, in itself is voluminous. There's a lot. And so the patients, the staff are working really hard for that. But again, those are our focus. There's delay in secondary billing. And that is when, insurances are, for example, Aetna insurance are billed, and then you have a share. We expect patients to pay as they leave, but that actually doesn't happen a lot. So they would walk out and then surprised with the bill. And of course, there's frustration when they receive the bill 2 to 3 years later. But that happens because of the, self-pay is not our cash cow. It's basically very few. We send patients bills. The return rate for collecting is very low. So our focus, because we need to run a hospital, we make sure that we focus on the big payers, Medicare, Medicaid, Aetna, especially Aetna, as being one of our best payers for private insurance. Thank you.
I have more questions, but I'll yield for now. Thank you.
Recognize President.
Thank you, Mr. Chairman. Your delay in secondary billings, that your receivables, what is the value of that?
Insurance or
Self-pay for whatever share they are supposed to pay before they walk out of the hospital. What would be your book value on that to date?
Oh, that's actually included in our non-Ben calculation. That averages 5 million to 5 million annually.
5 million annually
Yeah.
that you have yet to collect from services.
But
Yeah, and these are
portion are unbilled.
and these are bulk payments. Most of them are bulk
Mhm.
from surgery, from inpatient. The $5 here and there from outpatient are actually patients pay.
Mhm.
But when it comes to the big amount for 20% of a inpatient bill, those are actually, even though it's $5 million, probably some of them are probably in a payment agreement already. But we never say no to $5
Right.
deduction, so
Okay.
that's going to happen.
Well,
Yeah,
the reason
yeah.
why we ask all these questions, because, obviously you're a corporation and you do produce your income statement and your balance sheet. And it's always good to know your valuation, your market value today, as we speak with respect to all of these financials we are addressing today. Now, have you explored the opportunity with receivable assignment with CUC? Assuming, we use the numbers that we threw out today of $91 million local share that have yet to be received, and you have a arrears of $32 million. Have you explored the opportunity with CUC to assign your receivables of that value of money and let the central government deal with CUC just so that you remove these arrears from your books. Now, you're a corporation, so obviously when you talk to another corporation, it's all about mergers, right? And acquisitions. And when you go to the bank, it's all about selling your receivables and assigning your receivables too. And what is your market worth with respect to, are you able to float yourself out there in the open market as an entity itself, right? And so that's something that I want to give you guys an idea on. We talked about Chapter 2, Chapter 7 taxes being withheld. It brings me to mind to ask you the question of whether you're also withholding back your payables to your vendors, and what would be that value as well. No, so your vendors are fully paid.
We,
Up to date.
we
Up to
cannot not pay them. They will
Okay.
not provide medication. They would just won't provide it.
Okay, so your vendors are fully paid. Okay, so you don't have any, okay.
There's some payables, of
All right.
course.
Okay. I got you. And you know, I see the book entries. You're adjusting entries of debits and credits. Obviously, you claim you put it on your T account. One is an asset and the other is a liability. But at the end of it all, you know, then you have not realized receivables, and you have deferred payables to revenue and tax, things like that. And so we talk about washing the books, but in reality, it doesn't really wash out, because at the end of the day, the CNMI government is still not collecting its actual revenues from the entity itself of Chapter 2, Chapter 7 taxes. And that in itself, for the central government to also put on their books as, you know, a deferred collection of certain taxes from specific government entities or corporations. We agree? Thank you.
Thank you, Pers. Any other member? I recognize Senator Chu.
Thank you, Doc, and your team. Welcome back to the Senate. Just for consistency and perhaps maybe to provide some update, what you have in your financial statement is a $33 million receivables, correct? Of which approximately $19 million is quote unquote written off. Is that accurate? Mm-hmm. CHCC. That's a collect over a period of 3 fiscal years, calendar years.
Our receivables.
Mm-hmm.
So in our books, our receivables.
I mean, obviously, right? It's cumulative, like what you just said earlier. But what can you just share for the record to the committee? What is the turnaround time, and what's the hold up? What's the delay in terms of going after services that's being provided with folks that have insurance walking in? What's the turnaround time? Like I go in and I get treated, and I have insurance. You guys do all the paperwork before I leave. When do you get that money?
If your insurance is Aetna, we get it within 14 days.
With Aetna?
Yeah.
What about these other providers I see here? Other private?
Other private takes about 30, maybe 60, 90 days.
Or longer?
Longer.
Has there been instances whereby...
We threaten them.
No, not threat. Careful with that proper terminology.
There have been.
No, but I guess settlement or
Yes.
like, but
So we go through it and we reconcile, and then if just to try to clean the books, we do make a settlement. We accept a settlement payment.
Okay, then earlier, Ms. Santos, no? You referenced that 70% Medicaid and Medicaid PEs of your clients that you entertain. Can you elaborate a little bit more, maybe for more clarity on as far as that service that you guys provide? What does that represent in terms of dollars?
Yes. So, I just did a presentation to our board last night on the impact of the Medicaid to our financial statement last year. Because last year we reported about 7 million deficit, and we are working with Medicaid to do an adjustment of our rate because our reimbursement today is based on 2020 settled cost report. That means the rate Medicaid is reimbursing us today monthly as a interim payment was based on our cost in 2020 there was no surge in PE. So as the year passed, 2021, 22, and 23, we noticed that the cost has significantly increased because of the number of Medicaid covered patients have increased. So what we did is calculate the impact of that. Let's say our total hospital cost is 90 million and 70% of that is Medicaid. So 90 times 70, right? 63 million. And we only get 83% of that 63 million, right? So that's already a 13% that the government owes us. We record as receivable from the government. But then our actual reimbursement right now is only at 3.7 million per month. So we're under reimbursed by approximately 9 million last year, 8 to 9 million last year from federal match alone. We are not counting the local match. We're just recalculating 2020 based on 2020 cost. Because remember that what we got in 2020 as Medicaid payments were based on 2020 cost. So what we're trying to work with Medicaid now is we already know the cost of 2022 and we already know that the patient base increase. Can we recalculate? And good, it's a very we're fortunate that our Medicaid counterpart are agreeing to that recalculation. So but recalculating and finding out how much we're owed is just step one. Finding the funding to pay us is even harder because as we were discussing with Medicaid, they don't have the money. But we spent that, right? So we incurred the 7 million deficit and we had, yes. I'm gonna cry.
It's very complicated,
Yeah,
right?
it's very cumbersome,
Very,
complicated.
yeah,
I already lost you, quite frankly.
So what we're trying to say is that what we're trying to basically emphasize is that right now at this point we are getting reimbursed by Medicaid based on Medicare costs from 2020, from hospital costs from 2020. And so we have been sitting down with Medicaid to try to make that adjustment to give us the right cost. But that has been a discussion we've had with Medicaid, and they've accepted the adjustment. But again, the news is that there is no money, as you know, CNMI government, just like other territories, are capped. Yeah.
Thank you, CEO and Ms. Pearly. No, that's fine. I mean, that's why we're asking questions for repeat guidance. With this issue with the just booking that you just reviewed earlier about the C2 and Chapter 2 and Chapter 7, I think that it's blessed by your board, right?
Yes, the board is aware that we are not remitting, not only during my time, but even in the previous times. Whenever we get appropriation, we remit to the central government. It's almost often that when we get a significant appropriation, they request a new wash and remit to the central government for Chapter 2 and 7. But when we don't have cash and they don't have cash, then we just offset it to this growing pool of unfunded local match.
Okay. Well, I just want to make sure that I think the board knows I was going to ask this question. That's why she stepped out. But I'm just saying, for that, because it's very, it's a very serious revelation, no, from coming from this end. But how you for now, Madam Chairman?
Thank you.
guys.
I just want to clarify that, when we have our budget hearings, those are actually known. This shouldn't be a revelation. Yeah. It's been every year we've been talking about that, and it's a conversation that we've had with again with Secretary of Finance, the previous ones.
So you intend then to continue that?
Well, the issue here is, Medicaid has to be funded. There is a big portion that we still don't get. We're paid by CMS, or I'm sorry, the CNMI government has to pay the 20% for professional services for Tinian and Rhoda. If their claims are not getting paid, it's because the CNMI government doesn't have the money. And so we are helping the CNMI government by adjusting it through the cost. So it's, in a way, it helps everybody make sure that that somehow some payment is coming to the hospital, to the only hospital that provides services, right? So that's one of the reasons why this is, it seems, yeah, you're right. It is disturbing, but it's also disturbing that the government doesn't pay that 17%. Thank you.
Thank you, Senator Jude. I recognize President.
Thank you, Mr. Chairman. I have to give you credit for being a good negotiator with Medicaid. You would definitely negotiate when the reimbursement rate is higher, but you won't be negotiating when the reimbursement rate is lower, when the services were delivered in 2020 and you're negotiating at current market price at a higher reimbursement rate. So I give you a lot of credit for that. You're very lucky. My question, because you are a corporation, have you ever explored the opportunity to go out there to the financial institutions to get yourself a credit line facility to keep yourself afloat?
So we've managed to keep afloat based on what we have and not paying the two parties, right?
Okay.
I'm not. It's
So,
just-
so what we're saying today is that you do have liquidity.
yeah, if we are
Okay.
able to, go ahead.
Removing related party from the equation of current liabilities and current assets, the CHCC would have is liquid. Removing, totally writing it off will remove us from the red because our cumulative deficit is equivalent to our CUC bad debt.
I understand. And the reason why I bring up these conversations is because, again, I'm going to keep taking you back to your identification as a corporation, where I don't think anything restricts you from going out there into the open market to explore other financing opportunities to acquire an infusion of new capital for if ever you should need it. And if you have so much liquidity, removing all the other liabilities so that you could have a positive balance sheet. Obviously, that will be your caveat to sell yourselves to the financial institution, because you have a positive balance sheet as your marketing asset, right? That's what your market worth is. Now, I'm going to take you into your employee defined contribution plan. If you are members of that, I do understand that the way the plan is worked out is that if you have your employee contributing every payroll of 10%, that the employer must match 4%. And so are you in arrears of your contribution so that your employees do not lose the opportunity to grow their money, including your 4%, in the market that they're investing their mutual funds in? You're good on that? You're not delinquent? Okay, so they're making money. Okay, that's good to know. I yield for now.
Thank you, Madam President. I recognize Senator Cruz.
Thank you, Mr. Chairman. And good afternoon, CEO and staff. I just want to ask whether that 91 million is the medical referral included in that 91 million?
Well, that's just a hospital.
Just the hospital? Because I know that there's an arrangement between the medical referral with Medicaid patients that have been sent to foreign country like Philippines. I don't know if you guys are aware. Or is that, I understand that the medical referral will be the one paying, and then Medicaid will reimburse medical referral with the cost?
Medicaid would not reimburse the costs for medical referral if it's sent to the
So
Philippines.
it's not, that's
No.
not an accurate information that
No.
there's an arrangement that when we send and the patient don't have any insurance, but Medicaid, are we getting reimbursed for that or no?
No,
So-
you cannot
so-
get reimbursed because it's not in their state plan.
Just just to clarify that,
And-
because I know, I remember I raised that on a public hearing, and
And Senator, if you don't mind,
yeah,
I would
just-
just wanted to add that do for the HNP bill or law, it actually, we did recommend that it was for any patients that owe for any agreement that they signed, we recommended that they write it off, and that's supposed to be written off for any agreement with the patients.
Thank you. And in regards to dialysis, I know that the hospitals are incurring a lot of costs in regards to a lot of patients there that are not U.S. citizens, and they're not entitled or eligible for Medicaid. How do you deal with that nowadays with those patients that are not Medicaid? They're not qualified for Medicaid. Those foreign national that are not U.S. citizens.
We are supposed to be actually we're supposed to get reimbursed for that, but that has been confusing because initially we were pushing for anyone that needs it desperately for services that are desperately needed, that Medicaid will consider that as part of what they call emergency services. However, there has been some discussion about possibly excluding those. So we are definitely going to have to be eating that cost. You want to add on?
Right now with the PE, they're currently covered in PE, but will end soon, right? So yeah, but the state plan did include emergency and life threatening events to be covered by Medicaid. So end stage renal is life threatening. That should be covered. It's just that Medicaid need to put a procedure in place to properly identify those person and assign a claims number so that Medicaid would allow us to include them in our cost report for renal as a Medicaid patient. So it's just a matter of procedure.
Okay, so that's good, but we haven't get any yet from that procedure.
Not yet, but we're working on it. Yeah.
Okay, thank you, CEO. Thank you, Mr. Chairman.
Thank you. Before we go for another round, I recognize Chairman Paul Mangonia.
Thank you, Chairman Sidusmalsi. I want to go back to the disconnection notice and the demand for payment. But before I do, let me just ask a quick question on the local share of Medicaid. What is the term again? The technical term for using your current or whatever you have expended to use as matching? What is that term again? I'm sorry. No, there's a term where whatever CHCC spends, that could be worked out in lieu of an actual local government share.
It's called certified public expenditure.
Okay, certified public expenditure.
CPE.
So this $91 million actually you covered through the certified public expenditure, and so we are current in a way with as far as Medicaid is concerned, with us putting up our local share, right?
Right. They will not. They're not gonna require that advance. Right. They will not require that advance. Yeah.
Okay, so actually it's just what the local government should promise to cover the local share that we owe you, but as far as the federal side, we're current, right? That's not an issue.
Correct. That's not an
Okay.
issue. It's
So
yeah.
just funding that the government promised to pick up and give that to CHCC, and because they're not doing it, you're getting that certified public expense, right? That you're
Right.
so-
Right.
Okay,
So
all right.
we're
Just
eating-
wanna
we're- yeah.
clarify that, and that amount every year is roughly 12 million.
About 12 minutes? Um. Okay. Go ahead.
It varies depending on what the congressional local share
Okay, so
is.
what's the total Medicaid, local and federal roughly and the average?
Currently, it's 83% and 17% local.
What's in terms of dollar value? 50 million, 80 million? What?
So, sorry. So we're getting currently 3.7 million in federal match. So, yeah. Sorry. 3.7 is the 83%. So 4.5 would have been the total. Minus 3.7. About 750,000 monthly in
For-
local. About 757,000 monthly times 12 is 9 million
9
local
million.
match for this year. That is approximately how much CUC is asking us to pay monthly. The local match.
Yeah, so the local and the federal is all together. What's the number? Do the math, please.
4.7.
4.7 million a month.
4.7 million dollars based on 2020 costs
On a month.
per month. Yes.
Okay. Right. So so I know that we haven't actually. I wish we already have brought up CUC, but I noticed that in 2015 there was a signed agreement, and you never really paid 150,000 a month.
That
But-
was, I'm sorry, that was for the intent of having a solar power, working on through the net metering. That was
Oh,
part of that.
Okay, so
that-
then, but you had promised to pay that, and then in 2020, according to the letter, you promised to pay 69, and the government was gonna pay 219, and
150.
or 150 for a total of 219, and then you actually went through that deal, right? You
Yes, we
actually,
did.
okay, and then after that, my understanding is you were gonna do another extension, but CUC wouldn't grant it, right?
Mhm.
And so I guess what was that offer when CUC wouldn't grant you the extension? What are, I guess I'm after what today can you pay minimum to CUC?
We offered 225
So you can pay 225 today to CUC
monthly. Yeah.
monthly, and under the circumstances that you just explained where CUC is at now, you're okay with the 225.
Correct.
I have other. I'm gonna follow up, but I see Chair Senator Selena raising her hand. Is that related? Okay, so let me just please follow up with this. So you're ready to pay 225.
Correct.
Okay, and the solar doesn't have anything to do with this.
No.
Okay, so you're ready. Okay, and CUC do not. I mean, and so why aren't you paying that? I mean, you're only paying 69. Why are you?
We paid 219 last this month.
Oh, you started this month,
Yes.
and your plan is to continue at that rate.
Correct.
Okay, so um, can I know that you did an analysis, or Caitlin did an analysis on government rate versus commercial rate. Why is not CUC doing that? Why are you doing that? But you don't have to answer that. I'm just saying. So basically, what is the difference between commercial rate? I guess in percentage wise, how much more is government versus commercial rate? 50% more, 30% more.
For electricity, it's 10%.
Okay.
Sorry, let me pull up the numbers. For wastewater, it's about 2,000 some percent higher.
And for water, it's
And for water, I think it's on the first page of that
Okay.
packet.
so it would mean a difference of how much if we change your rate to commercial?
So based on our
Roughly per month,
calculation,
what would that mean?
per month, it would be around 270 a month at commercial
270,000?
per month. At the 1,000, yes, at the commercial rate per month.
The difference.
Oh, the difference.
If you were paying government commercial rate instead of government, how much would you save a month?
Save.
225.
I'm sorry?
225,000 saving. Our average monthly bill currently average 500,000 a month. If we convert that to commercial rate, it's about 274,000 a month. That is an average saving of 226,000.
Okay,
a
and did
month.
you guys offer, instead of offering to go commercial, did you offer, let's pay between commercial and government rate? Did you offer that? Counter offer or something? Is that discussed where instead of government rate, pay?
We did offer yesterday that if the 225 is low and dependent again on usage, is that at the end of the year, we will look at basically what we are settling with Medicaid and come back and make the adjustment and pay the difference, whatever the difference is, if based on our usage versus what we're paying. That's what we offered yesterday.
I'm just coming back to the issue of, I guess, your argument that you should be charged government rate, commercial rate instead of government rate. Was that ever discussed with CUC to get or some range between the two rates?
That was the bulk of our conversation yesterday when they called us in. It was about the commercial versus government rate. And there was a conversation where it seemed, even they seemed to agree that it had to be coming from a legislative body to make that change.
If
Okay.
I may.
Yes.
Our plea is for commercial rate, because how could a government agency that is underfunded, a government agency requiring subsidy, be subsidizing another government agency? That is our plea, is for commercial rate.
Okay, and do you know with CHCC, what's the percentage of your payment to CUC as government payer compared to the overall government rate payers? Is that CUC's 50% revenue, CUC's 10% revenue? Do you know? If we were to exempt you, how much revenue would that take away from CUC?
We do not know that exactly, but what I have is what I pulled out from their 2020 financial statement. During the year when we were paying, the bad debt reduced from 5 million to 2 million. That is a significant reduction in bad debt that is added to the fact that goes to the community. What we are saying is any form of payment from CHCC, the 225,000 a month, will significantly reduce the bad debt CUC recognized each year. Prior to 2020, when CHCC and the Sinamay government were making payment for CHCC, average bad debt in the financial statement of CUC is between 5 million to 6 million annually. And we all know, as CUC have said themselves, bad debt goes to FAC. And FAC goes to every bill each and every one of us pay. What we are saying is 225,000 a month payment from CHCC would significantly reduce the bad debt.
Okay, and I guess the question to CUC is what kind of a study or analysis they have done on their three categories of customer rates. But Chairman, for now, you.
Thank you. Rep. Selena, and then Rep. Mendiola, and then we'll have press, and then co-chair or vice chair.
Thank you, Chairman
Correction.
Donald
Senate.
Magnolia. I'm trying to understand how CHC does their whole fiscal balance sheet. Is it typical to be reimbursed by Medicaid based on a 2-year lag?
It's a long process with Medicare. So Medicaid reimburses us based on Medicare cost report. And the Medicare cost report takes about 2 years to settle because there's a lot of things that need to be reviewed every 2 years, basically. Every year, we review every year. The past.
Okay, so with that review of every year, I'm absolutely certain medical care will not decrease in the future.
Yes.
And it continues to increase yearly.
The cost of care has increased, especially after post-COVID, with workforce and medical supplies. It has,
And even, yes,
Yeah.
and even, and that's due to a lot of factors.
Right.
New technology, and the like. And so, statistically, you can calculate, of course, what the annual increase is. And because you've negotiated previously with Medicaid to give you your current negotiations with them, and they were able to accommodate that. I'm wondering if you guys can push that issue that annually this is what it looks like over the last decade or so. It has increased by an average, even an average of, let's say, 5, 10, 15, 20, 100%. And I'm wondering if that could be included in your negotiations in the future.
it is actually, there is a what they call market basket. What's it called? Market basket adjustment that they do that, but
All
it's
these
it's
terms.
still a small percentage.
Okay. And that was one of my questions. Currently in the recent budget, that was the amended budget that was passed, there was a $7 million local match that was included. So even if you were to get that from,
Medicaid, when they request for local match, that would be the local match for those payees requiring local match. Like
okay,
that cannot be drawn down without a local match being paid. So for payments Medicaid makes to us,
Mhm.
doesn't require that the government fork out a local fund because the CPE is stating that our expense is the match.
So it requires for us to take the percentage from the federal government.
first.
Yes, because otherwise, in any other payer, they would have to fork out the 17%, the match, or any other payer, except for CHCC for hospital-based services only, hospital, not Tinian Rodel or dental or immunization or some of the
But even
professional
if you
services.
were to be able to receive the 7 million based on all of those
Yes.
factors,
Yes,
it still wouldn't be enough. Is that correct?
about $9 million alone.
Sure.
Yeah, there is a shortfall.
Okay. And the way I'm hearing these disputes between CHCC and CUC, CHCC continues to push for and ask for to be reduced to the commercial rate. And in line with Senator Paul's question, in my mind, I was wondering if you guys have ever thought of any other alternatives rather than just to be accommodated to go down to commercial rate, because absent legislative action or fulfilling the PUC, Public Utilities Commission at CUC, who are the people in charge to set the rates. I don't see any other alternative absent any legislative. And then OPA is going to come back and say we're interfering and being bullies again.
Sorry if I used that word.
It's okay. I use it all the time, but it's true. It appeared in the OPA 2017 report, but then legislature is going to get blamed again.
Yeah.
And
Well, I mean, again, we are required to have two source. So right now we do have the backup generator as one source. If CUC disconnects us, we are basically at the verge of saying, okay, then we will need to get a second backup. And that will mean that we will get another generator and we won't pay CUC the 225. We can't. because we will be using that money for fuel. And what happens, and we discussed this with DOI, is what happens to the community then is because it will go back to the community. Then all of us will be paying for that loss of revenue from CHCC. We are a big payer. We are a big customer, if you maybe not a payer, but a customer. If we are off the grid, then that will eventually go to every single one of us to pay for that difference. But I have a hospital run, and I have to make sure that there is two sources. And we are actually in the process of purchasing a second generator, backup generators, two backup generators. So we are going to, if they are disconnecting us, our goal is to get off the grid. And if the customers have to foot the bill for the difference, unfortunately, I can't help in any other way. So that's why I'm asking for help. I don't want to do that.
One of the things we learned yesterday in a confirmation hearing for Mr. Simon Sanchez, who is experienced in utilities and the systems, he mentioned something that we were totally unfamiliar with, and I want to ask CHCC and eventually CUC when they come up here. Has CHCC have you guys ever done a what they call a cost of service analysis? How much would it cost you to provide the water you based on your average usage? And I think that's a good starting point for CHCC and CUC as far as all government customers are concerned, government accounts are concerned. So I think that's a very good starting point. It's not an easy or a cheap survey to do, but it is a start to actually know your cost. Has CHCC ever done or is planning to do one of those?
In 2010, when CPUC passed or added, allowed to be added the government rate for water and wastewater, it was also recommended that a cost of service study and rate design study be conducted. And as far as we're aware, we're not aware of any study that's been conducted. Maybe it has been, maybe it hasn't. But that would be something that we would be very interested in as well.
Generally speaking, how much revenue does CHCC realize every year on an annual basis? I mean, we can talk about Medicaid reimbursements and all that, but how much, we don't know the basics of how much revenue, how much expenses.
Sorry, I broke your mic. From 2018 to 2022, average, I cannot say average, our revenue grew from 68 million to 128 million, including federal funds. Sorry, I do not have on hand one that is only local. I only have on hand one that includes federal funds. So our revenue grew, but however, our expenditure also grew from 68 million to 135 million, which includes federal funds, including CUC. Our cost is driven by the number of patients we see. It's not something that we could ultimately control.
Especially with PE.
Yeah, we became especially vulnerable when we got PE. When everybody previously not seeking care, suddenly there's a line in our clinic, there's a line in our ER, because people not previously seeking care are sought care. Our oncology used to serve only 30 patients, now about 500. Yeah.
But the 500 increase means that there's early detection. So that has improved, at least with the lives of these people. Just I want to emphasize that.
Yeah. So if you see, like we always tell ourselves we are a victim of our own successes. as we grow our revenue, we also grow expenses. Remember, we're cost reimbursement for a majority of our payers. So if we don't spend, we don't get reimbursement. Then we would not be able to afford our fixed costs. So we're on a very difficult situation. It's like an algebraic equation if it has to be, because we are our reimbursement is driven by cost. People would say, reduce your costs, then that would reduce our reimbursement.
That's all I have for now. Chairman, I yield.
Thank you, Senator Babalta. I recognize the president.
Thank you, Mr. Chairman. And so I see your numbers, 128, including federal funds, revenue, and you have expenditures at 135 million, and pretty much leaves you with a -7. I would think that's annually correct. Or I, there, thank you. That's what I wanted to hear from you. There's years that are good, and that means your balance sheet is positive, net positive, right? Not net negative, right? And so that leads me to my question of, does the hospital place its cash in interest bearing accounts or high yielding accounts to generate money over your current money? Or are you in a bank account that's yielding less than 1%? Just so that you see where I'm going with this conversation.
Yeah.
It's always an issue in the Commonwealth where we come together at the legislature and it's all about money. How do we make money? How do we stimulate the economy to make money? Who do we collect from to make money? How do we apply for more federal grants to make money? But at the end of the day, we never really ask ourselves, how about exploring other financial instruments that would make us grow our own money on our books, in our bank accounts? And we shall not be restricted to local financial institutions where you put your money in, where you could explore other money market instruments out there that you could place your liquidity so you could make money off of your money. Does it make sense? As a corporation, right? And I see that you have to collect, you have to wait for Mr. Government to put in their share in order for you to draw down your money. But absent that infusion of match, you are left in a position where you can't move forward nor backwards to draw down this particular funding in that specific account because you have not received the matching fund from Mr. Government. And this is where I put in these ideas to explore the opportunity to make money off of your own money, because I do not think, I have read certain statutes that there's absolutely no restrictions, perhaps maybe only for some entities, that you are not restricted to go out there and explore. You're a CFO, you know what I'm talking about, where you could actually try to put in some of your liquidity in a higher interest-bearing account. I'll give you an example. If you were to think about it today as we speak, imagine if you have so much liquidity and you end on good times and sometimes -7, but let's just say that you end on a good year at $10 million and you end your books and you close your books and you're +10. Can you imagine taking that money, maybe half of it, and buying a nice corporate bond out there on a good company like Google, Microsoft, IBM, that pays a handsome coupon rate, that you could imagine the potential for you to generate your income on top of your money? Does that make sense? I think.
I was gonna-
Yes, I would encourage you guys. I speak this every time a department comes in here.
Yeah.
Because again, there's a few autonomous, semi-autonomous entities in the government. And here we are at the legislature trying to figure it out too, of
Yeah.
what particular industries are we going to attract to stimulate our economy, to diversify our economy. And we have MVA earlier that also needs money to promote our destination on a grand scale of competing destinations. But yet we have not really had this conversation where how can you make your own money too off of your money? So please, I encourage you guys to look into that, just so that you could continue to stay afloat. And while you're waiting for Mr. Government to put in that share so that you could access your money, in the meantime, you can be earning a nice coupon rate from a nice corporate, bond that is listed on the New York Stock Exchange, for example. Thank you.
Uh, Thank you, Senate President. That was really good. That's actually, in fact, you're right. It's definitely important for us to invest as well. And, even for ourselves, we know that we're in the business of healthcare, and we look at that. And, even some of the expenses that we make, for example, like expanding the OR, even that in itself, we only have 2 suites, and we are actually, it's part of our projects that we're looking into, so that we can not only, do some preventive work, especially with colonoscopy, for example, that we have a line of people that are waiting to get that service. We do need an additional suite. So we are investing in that. Those are one of the investments. We have brought in oncology, for example. We're also bringing in, we know it's an expense, but it's important for this community, and we also know how it eventually comes back. The reason why our revenue increases because of those investments. And we are going to, you're right about that. Other options, we are working on a foundation. We're actually going to start that as soon as possible. We've, trying to get the process working, as well as you mentioned, about some investments. But, it's always tight, but we look at it every month and say, if there's an opportunity, we will grab it. Thank you so much.
Thank you, CEO. Sure.
Thank you for mentioning your foundation, because if you look across the country, there's a lot of philanthropists that will want to dump their money on a socially responsible foundation in the interest of taking a tax credit. And so I'm happy to hear that today, and I hope and pray that you get a lot of philanthropists to put their monies into your foundation so that you could grow that, and eventually maybe hire your own money manager. Like NMC has its own foundation, and they grow that money into the millions of dollars. That's why they hold this golf tournament every year. But they're being managed by a reputable company that invests their monies in the open market, and they make dividends. They increase their capital appreciation based on their stock holdings in their portfolios. I am so happy to hear you tell us that today, and I look forward to you making millions of dollars so that you don't come here and ask us for a penny. Thank you.
First payer taxes.
Thank you. We will close out with the Vice Chair Karina, and then we'll switch over. Thank you.
Thank you so much, Chair. So first one is, sorry. So prior to yesterday's payment of 219K, right? That was paid to CUC. CHCC, did CHCC completely just stop paying CUC prior to yesterday's payment?
We've been paying the 69,000.
Oh, you have. So consistently you've been paying the
Yes,
69.
yes.
So there was never a time when you just stopped paying?
There was a pause, and usually it's because we do the reconciliation with Medicaid, and when Medicaid payment stops for a while, then we pause, but we did catch up.
So
But yeah, consistently
so you're
paying.
pretty much current
Correct.
on your,
With the
commitment, but
with the
now
commitment,
With
the
the
69.
commitment.
Yeah, with the commitment.
and I asked that question, right, because I mean, does CHCC acknowledge and recognize the financial burden and hardship that you have put CUC in when you stop making payments, or you're only paying partial?
So the agreement was that the government was supposed to pay the difference.
Nevertheless, CHCC receives the service despite who pays for it, right?
Correct. But
Okay. So I asked this because, it is logical and common knowledge that for any business to survive and remain operational, it is extremely, extremely critical that the company collects on the revenues it generates. So basically, whatever the CUC spends, right, to provide those service, it must collect those expenditures in order to continue to purchase the fuel and whatever else expenses they need to provide the mandated service. So the question that I would like to ask CHCC is, if CHCC acknowledges receiving the utility service from CUC, why haven't you paid knowing that you received the service? And even if it's at the commercial rate, at least make the payment because you did receive the service. And I say this because when you don't make the payments, you're putting CUC in a predicament where it affects their purchasing power. And when it affects their purchasing power, ultimately, where it all boils down to is it affects our people, our ratepayers. And so the whole purpose of this meeting, right, was to come to an understanding from and hear from both sides. But I'm just trying to put this out there in perspective for any business, that when a business conducts its operations, it has to collect. And you guys are putting CUCC in such a critical predicament where if they don't receive the collections, then that puts them at risk of purchasing the fuel. And if they don't purchase the fuel, it affects everybody, including the hospital, because if they don't have the fuel for the generators, then they would, we don't want any, what do you call those blackouts when they have blackouts? So eventually it spills over not just to the hospital, but the ratepayers in general. So, I guess my question is, why haven't you guys paid what you, even if if you converted at a commercial rate, why not just pay something to show good faith to CUC that you are acknowledging that you are receiving the service, and therefore you are paying what you can afford to pay?
So that was the
Yeah.
yeah. So that was the basis of the discussion with the governor and CUC when we sat down, a week ago, was to look into that and start, making settlement. But our intention really was that the government is responsible for this too. We can't continue. We also are suppliers. It affects, yes, it affects people's lives, but people actually can die if they're not getting the services that we can provide. And we could easily do that. We could easily say, okay, maybe we won't get the most expensive medication and kill the cancer and focusing on something cheaper that just prolongs a person's life. But we don't want to do that. And so we're asking the government, there is a big portion that's not paid by the government too. So if the government can't support CHCC, then why isn't the government helping with the payment of your utilities? We're not saying we're not going to, that's not our responsibility, but there's also a shared responsibility. And if we can't be paid for the match, then what are we to do? There is supposed to be, even if you look at the state plan for Medicaid in regards to the certified public expenditure, the certified public expenditure that is generated and rooted because it is a local government entity. We are a government entity. Where is the government helping with that match? And if that match is not given, then we are being put in a position where we have to make tough choices of what we're going to provide for the patients. And we all know what the value of health. And I get it. I'm not saying that we can't, but where is the government? And right now at this point, the government does not have the money. The governor has specifically said there is no money to help us. So if we can't, then that's when we said, okay, then we will take care of the 150,000. And that was our discussion at the utility, with the governor. And the governor did ask, can you accept that? And the answer was no. And so we're trying to resolve this too. but we have to be realistic also. It's not just, them not getting paid. We're not getting paid too. And we need to fix that too.
And I understand the whole rationale behind that, right? I'm just saying, like this is an issue between CHCC and the government, obviously. And I feel like CUC is being the sacrificial lamb because they're doing their part. They're doing their part to provide the service that the hospital needs, along with everybody else, all the ratepayers. And the issue that you have is with the government. So why penalize CUC for the non-payment? I'm just trying to look at it from that perspective, that you are sacrificing CUC's ability to conduct their business because you have an issue with the government who's not paying up. So you should take up that issue with the government. And this whole conversation just came about because of the disconnection notice that came out last week. And I'm not trying to pick any sides here. I'm just trying to be fair here, most especially to CUC, because I feel like they are the sacrificial lamb in all this, when all they're doing is doing their part to provide the service. All the while, the government, I don't know what the government is doing and why they're not paying, but this is an issue that needs to be taken up with them, and don't take it out on CUC by not paying.
But we
That's all
can,
I'm saying.
we can pay that.
I know, but the problem is with the government.
So we're offering what we can pay. And if
Okay.
that's not acceptable, then our option is to get off the grid.
So which leads me to my next question then. So in an earlier statement, you stated that it sounds like CUC is in agreement to that a legislation is needed for you guys to move forward with regards to the conversion of the commercial rate.
That was
Is that what I'm
discussed in
understanding?
closed session, yes.
Okay. So I think we are moving in the right direction, and obviously we need to have, or not, I don't know if we need to be even involved, but obviously CHCC and the government needs to have a serious conversation about this and figure out what needs to happen from now, because it affects everybody.
Correct.
So,
And I wish that everybody would, if we are going to move forward and say, okay, you pay CUC at the government rate,
Mhm.
the government rate is the result of a subsidy.
Right.
So subsidize CHCC,
Yes.
provide the match, then we will move forward.
Yes.
Thank
Okay,
you.
thank you.
Thank you, Chair. I know we were supposed to close out, but I just wanted to get a clarifying question in before we meet with the CUC. So it looks like the last agreement that was ever made was in August of 2020, and that was to last until, September of 2021. Why was the agreement only for a year? What was the plan to address whatever issues back then was moving forward?
There was supposed to be a second meeting in regards to basically put together the parties, but my understanding is because they did not have quorum, that we could not sit down with them.
So since September of 2021, no discussions were made in regards to
I believe there was
new
a
agreements?
discussion with them to have, from what I understood yesterday, was that Mr. Camacho was supposed to make some arrangements. Yeah, and I don't know what actually transpired, but there was no meeting with us on that.
Okay, so since September of 2021, you've been incurring all these charges and not even bringing that figure down because you've been paying the 69,000
We
without
were
any
expecting the
discussion.
government to be paying the 150,000. We were not notified that it was going to stop.
So at the end of that agreement in September 2021, that was it. They didn't cover the 150 after that agreement.
I believe they made some payments after.
Okay.
I don't know really what they paid.
Yeah. Now in 2015, there was an agreement to pay.
Can I add, Chair, one more thing?
Sure.
Before, the discussion that we had in regards to this was, and it was discussed at the meeting, was that they were going to use local appropriation, which was the amount of money that we had been asking that were previously appropriated by the CNMI government. So the decision to use appropriation from previous years to pay for the 150,000. However, we learned at the meeting with the governor that they were using the community loan to pay for that. So I don't know. I don't know which one is it, but from our understanding, because it was subsidy, again, going back to the subsidy rationale, if you're going to subsidize CHCC, we can pay. That was the purpose of that funding, was to use the appropriation from the previous years to pay the difference, 150,000. So it was not money coming from the generosity of the government. It was coming from the appropriation of CHCC. Thank
Okay.
you.
And what happened? So again, going back to 2015, there was also this proposed agreement, but it looks like CHCC defaulted on that agreement because the 150 weren't being remitted over. Is that correct?
It was an agreement between CHCC, the government, and CUCC. CUC.
So not
Not an issue.
CHCC and
No,
So-
it was everybody signed on that agreement.
and this
including the
was so
government.
that CHCC can enter or has entered into a net metering improvement
Oh,
co-op.
that one was the purpose for that was because we were pursuing solar energy for the hospital,
And
but
where is
that didn't transpire, so we did not proceed with that agreement.
Okay. Thank you. At this time, I would like to thank you and your team for your presentation and for answering questions from the members. However, we ask that you please wait in the gallery until we dismiss you pending the outcome of our meeting with CUC. And so thank you for your time.
Thank you.
At this time, members, and we will take a 5-minute recess while we get both parties to switch off. Thank you. Short recess. As we heard from CHCC, and we tried to get an understanding of their financials and trying to see how we can assist in this issue of delinquency with CUC. I know that the notice that went out and the invitation that went out for was then acting director Vorg. But from our understanding, or at least from the chair, they've agreed to come and testify before the committee. And so we have before us the current acting director, Betty Terlahi, and the newly elected chairwoman. Congratulations, Chairwoman Tenorio. And again, so basically, before we begin with questions, if there's anything that the CUC would like to, if you have any statement you have prepared, we give you that time now. Thank you.
Good afternoon, Chairman Maglonias and Chairman Maglonia. Thank you for the opportunity to be able to share with you on CUC's side as well. We sat back there and we listened to CHCC present on their situation to this August body, and we hear their dire financial situation. For the record, CUC is also in a critical financial situation. The economy has significantly declined. There's no secret on that. And that has impacted CUC's financials as well. For the last 13 years, maybe more, CUC has in good faith provided, we have provided utility services to CHC way longer than that, but for the last 13 years, there has been little or no payments made for the consumption that CHC has consumed. We have tried to work with CHCC over the years to find an amicable solution, and it is the same story we hear each and every time, that they cannot pay. Earlier, Esther said that it was bullying and scare tactics, and I think that's largely overstated. CUC has been holding off disconnections for many years, over a decade. We did in one time in 2020, and that was only for one day, less than 4 hours maybe, because we immediately got to the table again. But every time we hold off disconnections, it is in hope that they will pull through with the offers that they make each and every time, when it should have done so many times over the years. Each time we put a number on the table or in communications with them, it doesn't materialize quite well. And frankly speaking, it's hurting their state of affairs just as well. Because when they pay very little, their arrears still get higher and higher. And I'm not really sure, from both sides, it's significantly hurting their books as well. Earlier, they brought up that the government rate versus the commercial rate. It's true, the commercial pays less, but that's a rate that was submitted to PUC, was not contested at the time, and it was the understanding that the government rate for water and sewer was going to be a lot higher because the government wanted to subsidize the community. It is what it is, and CUC cannot just change the rate, even if we wanted to do so. So disputing a rate doesn't make them, doesn't relieve them of the obligation, because the rates were designed for full cost recovery. The CUC board has discussed, and they have plans to do a new rate study. And we haven't done one we haven't passed any new rates since 2012 for water, and 2012 for power, and 2014 for water. But we just can't reduce it now because the differences would be unaccounted for between the commercial and the government rate that CHCC wants to avail of. Another item, Brave, is the FAC rate, inclusive of bad debt, as Pearlie said. But I want to clarify on that matter, because what Pearlie explained is really significantly not true. The bad debt element in the fact rate is a very small portion of the allowance for uncollectible fuel bad debt. And that number was derived from 2012 when CHC's numbers was not 53 million. It was a lot lower. So that small percentage is not the total allowance for uncollectibles. It is only the allowance, a percent of the allowance for the receivables. And if that's a little complicated, I want to explain that if you have $1,000 in your uncollectible and the auditors determine that $100 of that, you have $1,000 in your receivables, and if $100 of that is uncollectible, then that percentage of that $100, so it could be again another 10% of what's uncollectible, so it would be $10 is what's uncollectible allowance. And then in the $10, only a small portion is the fuel again. And then a percent of that small portion is what goes into the fuel. And it's only the percentage of what's in the fuel portion, which is, again, it's not the whole $10. It's what portion of that. If $6 is the fuel, then the $6, we apply a percentage to that. So it's a very tiny element. But the purpose of that element being in the fact rate is that it's attributable to fuel for full cost fuel recovery. And so when you want to do full cost fuel recovery, the percentage of bad debt for fuel, a small allowance, is put back into the fuel rate. But it is not the 53 million, it's not passed on to every ratepayer for in the fact rate. And I want to make that clear because I know that the public's watching, and we definitely don't want them to be angry at CHCC either, right? Because the 53 million was told earlier that it was going into the bad debt. Penalties are also based on the outstanding balance. It's not interest, and it's assessed to all customers who don't pay their bills on time. The statute that establishes CUC, Public Law 16-17, requires CUC to run itself in a business-like manner. I know you're all familiar with that, but for the record, I'd like to point out a couple of excerpts from it. Under the management portion, the board contracts pursuant to 4 CMC 1602, the board shall adjust the utility services collection and rate structure so that within 3 complete fiscal year collections from a particular utility service are sufficient to recover the cost associated with the operation and delivery of the particular utility service. These costs shall include adequate financial reserves for debt service, if any, and the replacement costs of obsolete and damaged equipment. The same statute allows CUC to pass rate schedules for residential, commercial, industrial, or any other categories that it feels necessary, as long as all the rates are equal on all 3 islands. So that's how we came up with the rates for residential, commercial, and the government. Earlier, Senator Edith spoke out about how we could help the economy and drive investors. A critical factor to that economic equation is the sustainability of the utility system. What investor would want to take a large risk when the utility is holding up on its last leg because it can't make the necessary investment to sustain new large connections because we have not done replacement of our infrastructures? Before I wrap up, I just want to mention that we are still trying to satisfy the stipulated orders, which requires us to collect our receivables. We have received many federal funds for the many deficiencies itemized on the stipulated orders, and CUC has put in as much as it can squeeze out as well for these projects. But in my opinion, if CUC can collect what it is due, why should they continue to award us more funds to address these hugely costly projects? We are expected to carry out our fiduciary responsibilities as well as CEO Esther, but CUC has held it for too long, and we are at a position where Senator McGovern put it, CUC can no longer be the sacrificial lamb. It is CHCC's obligation to work out their receivables so they can pay their vendors. I don't think I can tell Mobile Oil to deliver fuel to CUC and go collect from CHC what they owe us. That's pretty much, in a nutshell, what's going on. At the end of the day, though, we do understand, but understanding doesn't really get us anywhere. CHCC is crying out to you all for help. While CUC may have concerns with some of the proposed solutions by both the House and the Senate, CUC will have no choice but to make the necessary adjustments as applicable and hope they don't impact CUC and the ratepayers significantly. But we are here to also request that the Senate body, and the government help CHCC get out of their situation, because CUC needs to collect what is due to them. Thank you.
Thank you, Acting Director Derlai. And so I think there's no question as to what CHCC owes and how much. And I guess that we've heard from CHCC the history. As far as the history is concerned, I don't think there's no question as to how you've derived at that figure. And so I guess what I wanted to ask is the amount. So what would be the repercussions if the legislature considers the legislation on allowing CHCC to go on that commercial rate? And not just moving forward, this would be applied back to 2011.
I would caution, because going back to 2011, our books have been submitted for review with federal, with stipulated orders. Anything retroactive would be a very big issue. So, however, going forward, if the legislature did pass something like that, then what can we do? We'd have to shoulder that loss for a while, right? The customers right now are currently sustaining CHCC with the very little payments that we're getting from them over the years. And it's at their sacrifice, because although we want to run more efficiently, we can't, right? And so the inefficiencies is what's keeping, what's keeping the rates high. So when we don't replace our infrastructures or do our maintenance as we should, then we run inefficiently, even in the water side, right? We have a lot of leaks, and those inefficiencies, are what's keeping the rates high. But if we're allowed to do that, if we're allowed to replace our costs, then the efficiencies can improve and the rates then can get lower. So going back to your question, it's just another mark on the books for loss, because we would be at about over 2 million. I mean, I think Purdy threw out a number, but our assessment in 2021 data was a little over 1.6. And that was when they were averaging 300,000. Now they're averaging about 500,000. So it's going to go up, I would say, over 2 million a year in losses. Those losses have to be accounted for somehow. So if we were to do a new rate study, it would have to be passed on. We'd have to recover it, and it would go into the rates. So everybody would end up having to pay some of it at the end of the day.
Thank you. So if we were to consider the legislation from today moving forward, what is an agreeable payment arrangement that CUC, and maybe this can't be something you answer right now, but what would be an agreeable payment arrangement in order to address the arrears? Is that something that you can work with to come up with a more affordable rate with CHCC? If we don't consider applying this retroactively, and it will just be from now forward, do you have a number as to how much you would agree to for CHCC or the central government to take care of its arrears.
Yes. The number that the board agreed to yesterday was 225 monthly on the arrears.
And plus, in addition to the
225,000
current,
And keeping up with their current bills,
billings.
yes.
Okay. Thank you. And I know there's been this discussion with a legislation that was currently introduced, and that would be to bring CHCC's rate down to a commercial rate. Looking at what was done in the past with the PSS, they also I guess Title 4 Division 8 allowed for the same what we're discussing right now to be applied with PSS, and that the difference in the rate would be applied to just the government rate for water and wastewater. When that statute, when that became law, did the rate in water and wastewater change? Do you recall?
We had proposed rates for an increase in water to recover some of those the losses from the fact that PSS went from government to commercial. Unfortunately, there hasn't been a active PUC to address that. So the rates have been withdrawn because there's no body. I believe that there are 2 members now, so we talked about that at the board meeting.
So how was CUC addressing that loss from PSS?
We are going to do a rate study very soon, and that increase would have to be back into the government again. At one point, CUC planned to do a 5-year level out where the government rates were going to be put to actual rates, because the government's struggling already, right? And so then the economy started to improve with some of the investments that were coming in at the time. Now that it's struggling again, it's probably in the best interest that we go back and look at it. The only thing is that the increase gets passed on to the residential and commercials. The 5-year plan was to allow it to gradually grow slowly if it had to grow, because we didn't want to impact the other customers' classifications significantly in 1 year.
Do you know, is the central government, are they current?
No, they're not.
How much in arrears? Is that something that you have with you?
The central government is about 9 million, 8.3 without penalties.
But you are assessing penalties?
Yes, we are. That's a little over 9 million, Chairman,
Okay.
without with
Okay.
penalties.
Do you know anything about that 3.5 million that was mentioned earlier that CHCC had mentioned in regards to an appropriation that was done and remitted over to CUC but wasn't applied to CHCC?
There has been some, I can't say that it's the exact 3.5 million, but there has been payments from the government in the past in bulk. A big amount was just before the net metering interconnection agreement, that there was a transfer. Actually, it was, I think if I'm not mistaken, it was just a presentation to Miss Esther, and then the director of CUC was also there, Mr. Camacho. So it was a transfer there, and then they took a picture and it was a transfer to the other director. So, it was paid to CHC and then right away paid to CUC. So it was paid to CHCC's utilities. It was applied to CHCC utilities, in other words. I
So-
don't know where that money came from, but it did come from the government. I know that happened at that time.
Okay. Well, these are
There's
These
actually more
two
than
separate-
3.5 million. I'm sorry. There's actually more than 3.5 million, but again, that'll happen before the interconnection agreement
Okay.
back in 2013, I want to say. 13, 14.
Okay. Now, how did the CUC come up with the proposed amount for CHCC of
The
9 million a month? Is that correct? Roughly 9 million a month to remain.
to remain to stay at disconnection, it is the current billing plus 225,000 on the arrears. So the 225,000 was based off the discussion with, I guess, what they could pay, and then the current billing would be going forward. They'd have to use collections to pay as well their current bills.
And how long is that agreement for that you're proposing?
It would be till the arrears are paid off. And see, the board also offered that, I mean, it's not in the offer yet, but the agreement was to be that if they made good payments after, I think, a year, that CUC was willing to waive that, write off the penalties.
All the penalties.
Yes. The penalties are not in our rates. It's just a deterrent.
Right.
So people would pay their bills. It's also the cost of doing business when you pay late. However, our rate structure is designed to collect the charges. And so that's why they're willing to remove penalties if the agreement is solid and there's consistency and a commitment to pay and show of commitment to pay.
Okay. I'll yield for now and allow for the members to ask questions. I recognize Chairman Paul.
I would just have a couple questions. You mentioned that with CHCC's arrears and all this rate structuring, but in recent articles also, CUC came out and said only 37% of water that is pumped, chlorinated, is generating revenue. And I think, and that's 63% that you guys are losing out, or roughly 200 million gallons per month of water that you're not making revenue on. And that's passing on the buck to everybody, not just CHCC, but residential and commercial customers as well. I think it is undisputed. The amounts, at least between CHCC and CUC, are undisputed based on our understanding here today. But the fact that CUC also has not been aggressive in addressing these issues, the water leaks, the water theft, I think, CUC needs to also put an effort into reducing this loss, because everybody's absorbing it, not just CHCC. And then the other thing is, I just took a quick look online on your rates. Water's 3.372 per 1,000 gallons, and that increased from 354 since March 2013, the last rate schedule, right, by CPUC. But we're trying to understand. Obviously, the legislature cannot fix it unless we enact legislation. But we're trying to, as Chairman Donald Miglonia alluded to ask both sides, what is an agreeable amount? And you've laid down the amounts that you're willing to accept. But this obviously is going to go on for quite some time. absent any payment or to significantly reduce CHCC's arrears, and CUC's efforts to mitigate, the water loss, the revenues lost from the water situation. But I just did a quick calculation of this $725,000 payment from CHCC that is acceptable to CUC, and it will take 235 years to pay off $54 million. And that simply is not acceptable. Not to the legislature, not to the public, not to CUC. We will be long gone before that is paid off. And it's not fair that the future generation will have to pay for that. So, and I know this is an executive matter actually to try and settle, but we're just trying to do our part that absent any legislation to eliminate both sides, CUC, it becomes a receivable for you. It becomes a payable, right, on CHCC side. If we zero that out, I mean, that's the easy solution. They get to report to be in the black on their financial statements. CUC also doesn't register that as a loss. So absent any legislation, what are other options aside from having CHCC? Because they're saying they can't afford it. And CUC saying we don't care. We'll disconnect you anyways if you don't agree to our terms. And I know, like I said, this has been a battle for quite some time. Back and forth, back and forth. What other solution would it help CHCC and CUC to suspend, just like we do here at the legislature, we suspend some items on the budget, to suspend government rate for all government agencies, government accounts? Can I hear your thoughts on that?
Can you clarify what you mean by to suspend government accounts? Suspend,
That rate and just apply the two rates, commercial and residential. Because obviously the way the law is written, the government is supposed to be subsidizing residential. But based on what you're telling us now, it's the residential that's subsidizing the government. The script has been flipped. And that's why we have so many constituents banging on our doors. So can I hear your thoughts about suspending government rates and for a few years and applying commercial rate to all government agencies? Because you obviously did it for PSS. It was done for PSS. So that creates a disparity now. And we're gonna have other government agencies coming here because they now know about it, So I'd like to hear your thoughts on that.
suspending government rates would significantly impact the financial situation of CUC. What's going to happen is the residential and commercial customers are not necessarily subsidizing the government. They're just sustaining it for the government, meaning because they're making their payments, we're able to make sacrifices to keep the power on for government, residential, and commercial. I would not recommend, suspending government rates until there's a solution, until there's a rate study done to pass the proper rates to even the government. If that's what the government wants its position to be now. Like I said, we did do a 5-year plan. At the time that the 5-year plan was finalizing, there was no body with the CPUC any longer. So that plan was put on hold. When it was just what was discussed at the board, and I don't want to go too much into it because it was all discussed during executive session, and so I keep asking her if it's okay if I discuss it. But she told me it's okay, right? So we have to do a new rate study, that's for sure, and we have to, see how we could find funds to invest in some of the infrastructures we need to improve on the non-revenue water, the water losses. That's a priority right now for the water and wastewater on the water side. We feel that number is actually not very accurate. That came out. We had informed the judge at the time when we had that presentation, because that's where the original numbers came from, that we feel that there's more to it than that, and that we think the numbers are not 100% correct. So the judge had asked us to present the new numbers by September, and that's something that there's a weekly meeting. In fact, there's one that I missed this afternoon because every week we have deadlines to meet to come up with the best way to calculate really what's the non-revenue water loss, and water losses, water from cost from water theft or any other leakages or anything like that. So that committee is working diligently on coming up with the best way to calculate that, and so that we can then pinpoint and fine tune the areas that we need to address, prioritize in resolving the leaks or the water thefts in an area, or what really is the cause, and so that we could address that situation and have, and hopefully that would bring down we feel bring down the water rates.
So CUC, if I understand it correctly, is not willing to suspend government rates until there's a rate study.
Yeah, I don't think we have the authority to do that anyway, because the rates were approved by CPUC, and that's the rates we have to go with.
Okay, I yield.
Recognize Senator Mendiola.
Thank you. Thank you, Chairman, both chairmen. So I just want to get to the bottom of this. And God forbids, we disconnect CHCC and, the services is inadequate. I can imagine the legislature, the executive branch, and I'm sure likewise CUC. So my underlying question is there a figure that we can agree to? And maybe this kind of discussion should be, or we sit between the administration, CHCC, and CUC, and kind of come to an agreement of what can be or what is affordable. Because I think both agencies are critical. Likewise, providing power and water. If we don't have adequate power and water to CHCC, then we're gonna have a problem there with not providing the services. So we're just gonna keep going in circles. And I also want to mention that the legislature, we keep having to deal with even government agencies requesting for more money. And the truth is, as we've heard and seen in the newspapers, there's really no money. So the challenge here now is, how do we come together, sit down and come to an agreement where we help CHCC, but we also try and collect some so that you guys can continue some sort of services. Maybe not 225,000, because they're talking about the only reason why their operations is being sustained is that they suspended these services. So my question is there a rate that we can agree to, or is there an amount where we can actually sit down and agree to between CHCC and CUC?
Even if we agree on a rate, we have a fiduciary responsibility as well. And, there's no desire to disconnect the hospital or any other customer for that matter, But if we continue to provide services and not recovering what we continue to pay for, then somebody else is going to go dry eventually. And who's it going to be? If we don't stop, who's not paying, right? Who will it be? Do we then cut residential services because we can't continue to carry the load for CHCC. And I'm just throwing this out that this is what we're foreseeing, is that it's such a burden to not be able to recover, but we continue to buy the fuel we need to supply a big entity and not get, payments when we should. So when the residentials pay, we sacrifice something that's non-fuel to be able to buy the fuel, which would include the fuel that would supply CHCC. So something's got to give in order to continue to work something out with CHCC. And that's where we're trying not to go, because who do we end up sacrificing from? The residentials, because the commercials are hurting already, and there's hardly any. The residentials are bigger customer now than commercials. Used to be the other way around. And that's going to be a big concern at that point, because even just like CHCC, we have people at home that need water to survive, right? Water is an essential. And if we start cutting services because we can't keep up with it's going to be a big issue for not just the government, but maybe beyond that. So
Thank you for that. So, bottom line up front, no. And this is so we can put it on the record so that we can actually understand what's our course of action here as a legislature as well. Because
we can't suspend, that's for sure.
I'm not talking about suspend. I'm talking about coming up with a payment plan.
Yeah. That's the minimum that the board has agreed to. If they are going to pay their current bills forward and there's a counter proposal on addressing the arrears, the board is still open to that discussion. What they sent out yesterday, I believe, is for them to hear back from them what their response is. So we haven't heard back from them. We heard from them today that they still can't pay. So again, I don't know what they're going to tell us that's any different. However, the plan was to just try to set something, get some kind of arrangement. We're not asking for them to, we know we can't squeeze another drop out of the lemon if it's dry already, right? So that 53 million is not going to fall into our hands overnight. And we understand that Senator Babauta pointed out that it's going to take, I don't recall the number, but I think she said 53 years. Is that right? Or am I thinking 53 million? Over 253 years. Okay, even worse. Okay. So, but that wasn't, that was a short-term solution. It's kind of like, let's get something going. And hopefully the government would also assist them with what they owe, CHCC. So we were thinking of a one-year plan only for that 725,000, and we'd revisit it. So it wasn't going to be a long-term agreement. It was going to be, let's just get something committed now, and we get back to the table after a year and see if anything's improved. Then we have to come up with something more acceptable to be able to recover and invest and put back what the community has been paying for, right? So either we invest whatever lump sum we get on infrastructures, or anything that would help for the rest of the community who have been paying.
Thank you. Are you for now?
Thank you, Mr. Chairman. I think we need to call in Judge Carter, but before we do that, we need to come up with some ideas among ourselves. And Mr. Chairman, I think that the committee needs to come back on our own and come up with ideas, because the more we hear from CHCC, the more we hear from CUC, I think there's somebody missing in the discussion, and that's the administration, right? Because the administration has to come up with these government utility payments, and it seems that they're not fulfilling their billings also. And so at the same time, I hear a lot about CPUC and rate study. Let me ask you, Madam Chair and Director. So this study, I assume it's done, but you did not present it to anyone because there's no PUC. So what does this study say? That was done how many years ago?
I think it was around 2014, 15.
Okay, so what does this recommend for commercial rate, government rate, and residential rate?
This I don't recall the final outcome because there was no CPUC. It kind of
So can we get a copy of this report? Is that something, I think we need to see that report, because even though it's outdated, right? But I guess it's more current than where we are today, right? Continuing using the existing rates.
I will have to dig some records. I think there was a presentation on it. Maybe that might be enough for you to see what the plan was. Or we can probably contact the rate
Okay, so-
consultants at the time and see if they still have it. But
Okay, and in a nutshell, what's the rate structure that they're proposing?
the proposal was to bring down the government rate over a 5-year period,
Okay,
so that the government rate is based on their actual costs, because the government was hurting already at the time.
okay, and the commercial rate also
The
bring
commercial,
them up a little bit?
right, and it was so that, in other words, they were then going to pay also what their actual cost was
Okay.
and not be subsidized.
Which
by
means
the
they'll pay a
government.
little bit more, right?
Yes, correct.
And what about the residential?
It'll apply to them too as well.
What
Senator
was the
Chairman.
recommendation? Go up a little bit or
Yes,
continue
both
to
of it would go up, but at the end of the day, if it's
reflective
it's-
of what the cost is, right, for the consumers, for the different categories, right?
Yes, correct. Our board at the time, or I think at the time we didn't have a board, Chairman. And the plan at the time was, I believe, that they were going to implement as well lifelines, which they did at one point, so
Okay.
that the low income would be able to apply for what was called a lifeline rate.
So
And
would you
s-
say that this rate study would be something similar that Guam did, rate study in Guam? Would you say that they're kind of similar kind of study?
I would think all the rate studies and utilities are pretty similar, but I don't know what Guam's plan was, or rate study was, so I can't
But did
comment on that.
CUC compared it and compared their rate study versus our rate study, that whether or not officially adopted was there before your board, right?
Guam has a very complex rate structure, so I think it'll be, that would be, for me, I wouldn't recommend it. Even the rate structure we have now we get complaints that it's too complicated. So, they use different type of fuel, so
Oh.
their rate structure is different, and it accounts for that
Okay,
situation.
so
Not
so
very-
anyway, going back to the rate study that you conducted, could that easily be updated?
Absolutely, yes.
And
In
so
fact,
what
it should.
what action have CUC done to update it?
I don't think there was any maybe drive to do it because there was no CPUC. We had other matters that needed to go to CPUC.
Yeah, but
And
there's a drive by PSS, or
Yes.
that was in 2013, and we've been hearing CHCC knocking also to have the same treatment, and other agencies maybe will come up. So I think it's to CUC's benefit to finish that study, right? So that then whether you have PUC or not, you could come to the legislature, although that's the last thing you want to do per OPA report, right? But if there's no PUC, the legislature created that, and they don't, the administration or whoever, they don't want to, I guess, be operational, then we might have to step in at that point. And if we do, then we would sanction your rate study, right? We can pass that today and the House tomorrow and get the rate study passed, even if without PUC, right? Better than to pass Band-Aids, answer, right? So wouldn't it be to your interest to finish that rate study and present it to the legislature if there's no PUC?
We continue to work with our rate consultants. And in fact, when there's a situation, we always ask for an impact analysis. So
How long would it take for the rate study, do you think, to be updated? Have any idea?
I give it, we
6
can put a
months?
timeline to it, 3 to 6 months, yeah, depending on
Okay.
which rate and how many of the rates. Are we doing just the power? Are we doing power, water, and wastewater? So it would depend, Chairman, but the board's ready to do a new one, which we're really due for one. So again, maybe 6 months.
for the purposes that we're here today, can we just use the one that's done already so that then we can sit down with CHCC based on that rate study that was done in 2015 and then get the administration to join us, get a task force going and resolve it? Because, I don't think we could ever, even if we pass that bill to give maybe CUC government commercial rate, I think we'll still need to come back because as you mentioned, it will create an imbalance, right? And we have to try to balance that out again. So it has to be like a 6-month solution that we need to come in and address that. And I don't know, it would take the two corporation to come in with us and Secretary of Finance, of course, they're representing the administration and also the maybe people doing the rate study, right? And let's sit down and address this because I think this is gonna continue on and on every year because we heard from CHCC all the issues that they face, the challenges, and there's just a lot of people that they have to deal with in order for them to realize their anticipated revenue to be able to pay you. And sometimes they have to force payment by the government, right, by offsetting taxes that was discussed by Senator earlier. So I think that the just like you're trying to force CHCC to pay for 1 year, right? Then you might even waive their penalties. I think we need to say let's get some agreement, bring in Secretary of Finance, and then come together and lock ourselves in there and get an agreement that we're gonna finish the rate study. We're gonna look at all your other projects that are ongoing, because I think a lot of your projects ongoing will help your financial situation. I understand based on the centric report, citizen-centric report, you're going to be getting 21 million per year, right, from the infrastructure bipartisan legislation. I understand, right? That's for the next 5 years, $21 million to work on the water issues, and that's going to help you a lot. That's 21 million infusion every year to CUC. So, putting those into consideration, finance coming in and now being more attentive to CHCC and CUC, and then them trying to catch up on the monthly payment, right? Maybe if we work with them a little bit, the 225 might come up to 325, and maybe we'll meet there for 6 months and work on the rate study and then work from there. And then finance also will be coming in to subsidize, right? So I think that we cannot solve this without all the key players coming in. I really think that CHCC cannot pay 725 now if the government doesn't pay them or help them out on the Medicaid local mats also, even if just 2 million a year. That would, if the government can promise 2 million a year to CHCC on behalf of CHCC for the local matching to pay their arrears, then we could actually close the deal today. But we need finance to commit at least 2 million for local matching every year, right? And then but the players have to be in the room. So but not being participants in your discussion with CHCC, we don't know where to go from here. So has there been any serious attempt? I'm sorry, since the disconnection notice came out, because what I'm hearing today is CHCC is having a position, you have a position, but I haven't heard like trying to meet in the middle, and it's gonna be hard to meet in the middle if the Secretary of Finance is not here, right? Is that correct? I don't know. I mean, do we need the Secretary of Finance to join us?
Chairman, I understand everything you're saying, and I don't disagree with a lot of it. I just think finance agreement is with them. So for us to co-finance to pay for their bill is, I only learned today about the 91, that's not something we knew. They just said that they're owed money. The other day at the governor's office, I heard 50 million for Medicaid, I think it was. So at first I heard of the 91. So, again, if I quote finance, they're going to say, that's not your business. We'll talk to CHCC.
Oh, I
right?
think they are a player because we're trying to adjust your rates, and I know that maybe they shouldn't have a lot of say in that because you're actually an independent corporation and you're supposed to be self-sustaining, right? And that, but it's gonna tremendously affect them if we change the rate, and they're gonna pay, or maybe they're thinking they're going to pay less, right? So because if you have a rate adjustment, the government most likely will pay less, and commercial will go up a little bit. But I think they have a stake in this discussion, and also because of the offsetting that they're doing. Right, so they need to come here, and we need to hear from them. And I think that's the only way that we can sit down. But let me go back one step. Do you think that you two can settle it? Your two corporations can settle it without the legislature, based on how it's going on now or the last few days? I'm sorry. Yeah, well, you can answer, Chair. I'm just hearing today. I'm sorry because today what I'm hearing is CUC is saying this, you're saying this, and I'm in CHCC, and I don't see that you're coming closer.
We have to have an acceptable agreement, that's for sure. Because anything less than their monthly bill is just increasing the receivable, the outstanding of CHCC.
Let's say that they pay a rate in the middle between government and commercial, and they agree to pay that until we get your rate study done, and until we get finance to all agree in 6 months or 4 months. We'll have a task force done or formed between House and Senate, PUTC. We'll create a task force and get Secretary of Finance involved and get you two agencies involved to arrive at something. But in the meantime, they agree to pay whatever that rate is between commercial and government, and then we'll just go from there, and we'll work hard to resolve it. What's your opinion on that?
Chairman, with all due respect, I understand the request, but if CUC does that and acknowledges it that way, then what's not to say all the other agencies are going to follow? We have CPA, we have
what's
government.
going to stave those off is the study. We're coming out with the study in 6 months. We're going to finish it, right?
But if everybody came forward today, because CHC is going to get that today without out of the regulations, then we wouldn't be able to discriminate the other agencies who are going to claim the same thing. And then we won't be able to sustain at all.
I think
it would be a problem.
CHCC, we all agree, is kind of a little bit different, right, from the other agencies. It's a matter of health care, right? I mean, I'm just trying to see where we can meet till we can all agree on a rate study and get finance involved, and you have also time to reassess how your situation will be with all this influx of infrastructure money that can help you, I guess, in your operation and all that. And it's not admitting to the fact that you're charging them a different rate. It's just maybe even with the meeting with Secretary of Finance, they might agree to subsidize CUC that additional payment, so at least they meet their 500,000 a month usage, consumer usage. I mean, this discussion that I'm bringing up, and it's just coming off the top of my head. Is that something presently going on between you two?
We met with them, Chairman, yesterday, and they sang the same song as they did today. And we hear their cry, but it's again, they should be the one banging on finance's door and saying, you need to pay now.
So that's why I'm
because-
sorry.
yes,
That's why I guess I'm going to offer to
yes.
the committee and the president and hopefully jointly with the PUTC now to the speaker so that we can, because this thing is going to keep coming back every year, every other year, right? We talked about this 2 years ago when that one-day power outage, right, took place. And so I think we just have to force the issue through a task force, a joint task force. But at least if the Secretary of Finance has to agree with CHCC to pay at least the monthly expenditure usage of monthly consumption of power.
The chair has advised that if we get at least the current monthly bill for March, that she will instruct the disconnection to stay. So with that said, we'll come back to the table and negotiate before the next month's disconnection is up again. So they got to pay their full month of March, and then we'll negotiate.
What's their full month of March?
They've already made a 219,000 payments, so the difference between the 500, whatever their
I
March
see.
bills, and they get part of that $500,000 bill is paid for also by federal funds. So it's not the whole five coming out of their local funds. I don't know the numbers, but there's a good amount that's paid by federal monies.
Okay, but and that we can go back to them, but I guess I'm thinking about the longer picture here. Is that reasonable to sit down and address the longer term issues and challenges? Maybe a task force, House joint task force, House Senate, both corporation, and the challenge is to see how we can work on that new rate structure and I guess all these payments to CHCC and all that. Would that help, or is just a waste of time?
Chairman, we'll bring it back to the board. That's what the chairwoman is telling me. If we have a task force, I mean, maybe we just need to do the rate study, but at the end of the day, it's just coming to an agreement of how to pay the arrears and its monthly dues. And again, if we need the other party that owes them money to be able to pay what is due, then that would significantly help their situation, because we still have to do what we have to do at the end of the day, right?
Well, the reason I bring this up is because, really, I am really amazed, surprised that this thing happened before ARPA, right? And I'm just surprised that, I don't know, maybe ARPA could have been used to pay CHCC even half of what they owe, right? The 30 million 2 years ago. I'm just surprised. So I'm bringing this up because if there is some reimbursement from ARPA, I think that's why I'm saying Sector of Finance should be involved. So if there's reimbursement in the future, I think we need to address this thing. We cannot keep kicking the can down the road. We have to say, put in the first reimburse ARPA, put in 10 million immediately, and the next one another 10, and take care of this thing. So I'm just saying that not only that, I'm thinking MPLT interest income that we committed to, I believe that's being deducted from, was it matching fund for the Typhoon U2? Once that completed, we could tag that on, and those are long-term solutions that we can come up with through the task force, and so that we don't continue to have this lingering, right? And so I guess, Mr. Chairman, I know this is something that the committee might have to discuss further, but because it doesn't seem like you're coming closer to a solution. I'm just surprised that I thought by today's hearing you'll be coming closer, but obviously it's like one side throwing an option, the other side saying, no, this is it, and there's nobody meeting in between. I'm just surprised. Is Secretary of Finance involved in this discussion? See,
Hi, Chair. No, she's not.
She's not?
actually.
Okay.
Yeah, she's not, to answer your question. However, though, may I take this back to my board and propose so we can have a common, because what was agreed and what was written to CFO of the 225, actually the 750, right? 50, I'm sorry, 725 was actually approved by the board, but I can bring it back. And all we want to see is actually their current bill, reoccurring charge is actually about 500 plus thousand. So if CHCC can commit in paying that, then we can go to legislation in regards to um, um, satisfying their arrears, get reimbursement from. There's some legislation that I'm also working with the House in regards to trying to pay off like an offset type of thing, whereas CUC owes also the government, meaning the 1% OPA, to be close to probably about 17 million that could be written off and be sort of a payment to CHCC. And there are other means as well as the way CFO for CHCC has described, where they're doing like a offset type of thing. So if you allow me to go back to my board and, meet with them, um, I solely want to get my board in this discussion and the approval. And surely your recommendation in regards to getting together and whatnot. I do want to thank the CFO and her team. We had a executive session yesterday, and I called her up to please come up so we can have a discussion. We heard, similar situation and the process of collection and the payments that they're trying to do. So we understand. But I hope also that everyone understands that what CUC, the stipulated order, and what we need to be receiving from at least the current billing. We expect the residential and the consumers and other government agencies that able to pay their current bills, arrears, we can at least do a payment plan with them and whatnot in a reasonable manner, but or come up with an offset type of thing. I'm sure that my board is willing to consider that and whatnot. But if you allow me to take this back to my board and have a discussion.
thank you, Chair. You two other members?
Thank you, Chair. And I'm glad you brought up the topic of stipulated orders. I actually have two questions. So if I could just start with the first one. I know that a payment was already made yesterday for the 219K, but is CUC still going to move forward with the disconnection based on the disconnection notice that was issued last week? Because I'm assuming that the 219 was applied towards their current bill and not their arrears.
Oh, can you say?
Yeah. Oh, here, April 19th.
The 219 was paid April 19. Just to clarify. Not
Right,
yet,
and that was applied towards their current bill and not their arrears, right? So, and I'm asking because the disconnection applies to their arrears, obviously.
Go ahead.
All their billings are already outstanding as of this date, even March's. So if it applies to the arrears, and our system, it will automatically apply to the
Right.
arrears. Any system would pay the old accounts first, right? What they want is it to apply to current and not the arrears.
Oh, okay.
And
So it was the other
so,
way around.
yes,
Okay.
we have not come to that agreement as of this time. Yeah.
Okay. So, with regards to the stipulated orders, can you just share with us what are the requirements of the stipulated orders with regards to receivables and changes to rates? And are there any serious implications and risks that CUC faces if they do not comply with those stipulated orders? If so, what are those implications and risks? And I think this is very important for the public to know because CUC is also in a bind.
Yeah. I know that we're live here, but it's not really safe to say. But in accordance with the EPA meeting that CUC has, it will be under receivership.
And that is kind of the reason why I asked this question and why it's so important and critical, right? That there's an understanding of what CUC also faces if, you guys don't comply with the stipulated orders.
Yes, Senator. Thank you. Go ahead.
They are they are asking for all the disconnect notices. So they're watching this, that's for sure. Yeah.
That's all I have. Thank you.
Thank you. Recognize Senator Babauta.
Thank you, Chairman Donald Magnolia. I stand corrected, by the way, in my earlier statement that it would take 250 years. It's actually 253 months, or roughly 20 to 21 years. It's been a long day. And one of the I've asked this of we have asked this of CHCC earlier. I will pose the same question to CUC. How has CUC been able to sustain or stay afloat? CHCC already explained how they were able to stay afloat by offset, and other strategies. How has CUC been able to stay afloat if you are owed 53 million? From one government agency alone and central government 9 million. How are you guys able to provide power, water, wastewater services to everybody in the community?
Earlier, you alluded to bandage approach. And I hate to say that, but when you don't have much money and your only option is to do temporary fixes in hopes that, you could secure funding later on or something like that to be able to find a permanent or long-term solution. It's not the best practice for any corporation, let alone your only utility corporation. And so we can never move forward. We can never become a better utility. We cannot expand on things like renewables if we don't focus on what we have now. Because even if you go into renewables, you still need your power plant to be able to stand by when there's no sun, right? Or when there's no wind or whatever it is we're going to do. But we got to fix what we have now before we start
But what
going into the bigger picture.
steps have you taken to stay afloat? We also, during yesterday's confirmation hearing of Mr. Sanchez, based on his knowledge that it is not the best approach to go 100% renewable because that costs more. And he gave us an example of a town or a village in American Samoa that is 100% renewable, and that their rates are even higher than what we're experiencing here. But what steps have you guys taken do you offset? Are your vendors, current payments to vendors? Do you also offset your Chapter 2, Chapter 7 like CHCC does? Or do you offset the 1% OPA fee? So we can gain a better understanding of your financials and how you guys stay afloat.
I know the 1% OP fee has been suspended on our side, and that's primarily began because we feel that a 1% fee on the fuel, which is a pass-through rate for the customers, is really just an added burden on the customers to add that on to the high fuel cost now. So we had been trying to work with legislatures to exempt the fuel portion from the 1% fee. And then later on, it was exempt CUC, since we hire our own private auditors anyway. We really don't use, if we do, very occasional do we use OPA services. That's something that we're still discussing with the legislature today on that 1% fee, but that's something we have forgone. For the most part, we've been just sacrificing larger items that we could repair by, short-term fixes maybe. I mean, there's a lot of things we need to do. We can go back and provide a long list, and we want to improve in technology so that our customers get nicer bills and purchase infrastructures that would modernize, from billings to meters to devices. But those are a lot of the things we put on hold, and we just kind of fund what's really priority. And so all the wish list items get put aside, and I mean wish list as in list of things that we'd like to have to improve, but we have to do what we need to do to kind of just sustain our operations at this time.
In line with that questioning, given the financial situation of the entire government, what cutting measures has CUC implemented in the last 4-5 months?
In the last 4 or 5 months, actually, we've been doing these cost-cutting measures for the last 3 years. All managers and standby staff, even administrative staff that get called on the 24-hour, we've cut their cell phones. No one is allowed to take a vehicle home unless they're authorized on a standby schedule. That's approved by there's more controls to make sure that happens. We have cut down our cleaning services to 3 days a week in heavy traffic areas and 2 days a week in others. So we've done things. It's sometimes it's not enough, but we're trying our best. And what we're trying not to do is cut the hours of the staff, and I'll say why. Because the last time we did that, we actually end up spending more, because when you put people off and you're a 24-hour operation, and then you have these emergencies like leaks and things like that, and people are already off and they're already consuming alcohol at a party or something like that, you end up calling other people who probably already maxed out 40. So we ended up paying more overtime. And that was the result of the last austerity that we tried to do. So we did the analysis, and it ended up costing us a lot more. Trying to do away with less hours on a 24-hour shift, which are power, water, and wastewater all have 24-hour schedules. Yes.
Same question I posed to CHCC. What is the revenue of CUC per year?
Our projections for the FY 2024 is significantly less than 2007 when I did budget. It's 115 now, 115 million.
For 2024. And what are your average or projected expenses?
Fuel alone is about 70 plus million, I think 72, but that's just a projection, so that's a good portion of the operations. I think the personnel cost, do you have it, is about 21, 22, and then the remainder is, do you have that amount?
The remainder would be operations.
Yes,
is that correct? Yeah.
correct.
Okay.
We have over 100 vacancies, because that's one of the sacrifices we're making, is shuffling people around to areas.
The 115 million projected revenue for FY 2024, does that include any federal funds?
No.
Why not?
The
Have you guys not looked at options to receive grants or?
I'm sorry, the grants are not included in this submission.
Do you know approximately how much in grants you guys get per year?
I don't have that number today. Sorry.
Okay.
I can provide that number to you though.
It would help us understand,
Yes.
your budget. I just want to state, I don't have any more questions, but I just want to state that I'm working with a consultant who provides pro bono services to my office. And I work in conjunction with the administration. And we have a plan. When the CUC disconnection notice went out, I immediately went into a conference call with the governor and some investment attorneys that are known to me. And we're working on a solution between CHCC and CUC. If it's any consolation and assurance to you guys, tomorrow we're due for another conference call with bond investment attorneys, but it doesn't necessarily mean we're going to float a bond. We can't, especially for operations. The Constitution disallows that. But we're trying to work on a solution, and hopefully it will satisfy both sides. I think it will. And I'll keep you guys posted on those conversations I have with some financial people I'm working with. I yield for now, Chairman Donald.
Thank you, Senator Balta. I'll wrap up here with a couple of clarifying questions, and then we can close out. Why the jump in the projected revenue for fiscal year 24? You're saying 115, and then the current fiscal year you're at 90.7.
Where's the fuel? Could I have a minute?
Sure.
If you look at the fuel cost, I think the projected fuel cost for FY24, there's a good 20 million difference there. And like I said, it's a pass through, so it doesn't really give us any extra funding. If it goes down, then, that's a restricted line item. So if we anticipate that should the rates go up, we're covered in that regard, because that's the trend right now with the situation in around the world. Yes, globally. Sorry.
So what you're saying is, well, I mean, other than seeing it go down 2 days ago, but then it was up a few weeks ago, you're saying that you're projecting 20 million next fiscal year in anticipation of a larger increase in fuel costs?
Should there be a larger increase, we just can't predict the cost of fuel, but we've seen it a lot higher than what it is now. And so that might be the projected rate. But if you look at it, our budget went down this year because if you take out the fuel alone, it's about 5 million, almost 5 million less than FY 2023.
Okay. Was there ever a discussion on salary increase within CUC?
Chairman, there's no salary increase in this year's budget.
Right, but was it ever a discussion that was going to be proposed?
Not that I'm aware of.
So there's no truth to the idea that the previous executive director would have gone up to 200x thousand upon
That's-
renewal of the contract?
That's correct.
Okay.
I'm not aware of that at all. My department would prepare those contracts, and we were never informed of any
Thank you.
additional.
I just wanted to clear the air there. It's a good thing you mentioned OPA fees, because that's actually what I had written down. And Madam Chair, you mentioned that it was a discussion in regards to a bill that you're working on. Why or whose decision was it to suspend the 1% reported for this fiscal year?
Chair, I would assume the former director and the previous board
Does
I-
CUC have the authority to suspend the 1% OPA fee that is required of every agency to budget for?
Chair, I don't think I have anything in black and white, but I do recall that there has been conversation between OPA many years ago, I'd say over 5 years ago, where the conversation was for OPA to actually wait, because I think there's a provision in the law that says if OPA agrees to the reduced rate that or something to that effect. So since that time, we had been working with legislators, and so the 1% was just held off because of the financial constraints that we were experiencing at the same time, in hopes that the legislation would pass that year to reduce the 1% or waive it entirely for CUC, because it's just something that's going to go back into the rates and impact the ratepayers as well.
But you're saying that there's about 17 million that is owed to OPA. If you're averaging about 1 million in OPA fee a year, you're talking about close to 17 years of arrears in OPA fee. So shouldn't that have been addressed in the rates 17 years ago, as opposed to just now deciding to suspend it so that people don't get the effects of that 1%?
The legislature is trying to offset that against CHCC's arrears, so that would help both books.
Right. But that's a discussion now. But
Mhm.
17 million has been your arrears for the past close to 17 years if we're averaging 1 million a year.
Mhm.
And it's a good thing this was brought up. Was the 1% suspended last fiscal year? Are you aware of?
I don't recall the number of years, but I think it goes all the way back to 2007 or 8, maybe. I do recall who the director
Since
was
they
at the time.
suspended the
So
1%,
yes,
that's recorded in the
somewhere
budget.
around that time. Yes.
I don't think,
Which-
and we can clarify with council at a later time if the 1%, if there's even that authority for OPA to suspend that 1% or even reduce it for that matter.
I don't think it was about them agreeing to suspending it. It was just that so that they would. There's something that says that it could be reduced as long as OP agreed to it. Something to
There's
that
always a
effect.
discussion of we don't feel like we need to pay the 1% because we have our own internal auditors. We don't use OPA and so on and so forth. And so, but absent any legislation suspending that, every agency is still required to put in that 1%. And so, in that understanding, and maybe this is something that the committee can further look into, is that by suspending your arrears with OPA, what can that guarantee moving forward with the arrears with CHCC? If that's something that we can, kind of get the conversation started prior to the May 4th deadline. In addition, would eliminating the late fee cause any issues in regards to the stipulating orders? Earlier you mentioned it was just a deterrent. So is that something that could be part of the agreement if we were to waive the OPA, that we also waive the late fee and then kind of work on the principal amount?
I don't know what the DOJ and EPA would think about that, but I would say that if it is part of the negotiation to collect on what they've consumed, which is the 32, 33 million, then that would be the agreement. It's I can clarify it if you'd like a response on that, but to go back also to the OPA, just want to clarify that I think that suspension was primarily because we felt that it was going to go right back into the rates, and that we were asking for that consideration that when the consumers are, struggling to pay their bills and complaining about the high rates, that was one way we immediately thought that it would help reduce the rates, even if it was by half a penny at the time or up to a penny, it was a reduction nonetheless. And so that was the position at the time.
I understand that, but that would have been a discussion with the legislature and not CUC to make a decision alone. Actually, I have the statute here in front of me. The executive directors of all public corporation or other autonomous agencies of the Commonwealth, which are not funded primarily by legislative appropriations, shall pay to the public auditor an amount not less than the greater of 1% of his total operations budget from sources other than legislative appropriations or pursuant to any further formula upon which the public auditor and the agency may agree. And so it seems like nothing was agreed upon. There wasn't any suspension of 1%. And thank you for making rates cheaper. But if, this is like CUC taking matters into its own hand and suspending the law for CUC. And, have you applied that 1% and we saw the rates because of that 1%, then that's something that the legislature back then would have addressed and say, let's suspend the 1%. But, that being used as an excuse not to pay the 1%, I think is, I guess unfair also for other agencies that have paid that 1%. And so, again, we're just trying to come to a solution where all legislature, administration, as well as these two corporations can avert the May 4th disconnection. And if the suspension of the OPA fee and what is owed to OPA, the waiving of those fees, if that can be part of your discussion, in addition to the removal of the late fees with CHCC, with your earlier statement that that was just used as a method to cause people not to be late on their fees, then could that be factored in addition to maybe future OPA fees be used to offset the remaining 30 some million if we remove the late fees? But I guess that's something, again, that the chair would have to bring to the board members. And I hope that there's something can be done prior to May 4th. And so if you want to, at least for the meantime, push back that disconnection notice to allow the legislature or the administration to make that determination and get this signed into law or whatever other methods we would all agree upon, then that's something I hope that, again, the board can consider. Again, we're having this meeting today, and I understand there was a request to extend it, but we're faced with this May 4th deadline, and we haven't heard about actions taken to kind of avert that deadline. And so I guess we'll find out early next week if any decisions are made by the board. And so with that, Chair Paul, do you have anything?
Yeah, just one question. So where are we as far as the acting executive director? Do you have any comment as to why the last one just abruptly resigned? Should we be aware of what's going on?
The acting, the acting, he was actually hired as a deputy executive director for water wastewater, and I put him on acting ship when the former acting director was terminated.
So he's still with CUC, but not as executive acting.
For now until May
12th.
May 12th.
Would that affect?
He resigned actually.
So that's going to affect the our addressing the stipulated order, right? That's going to hurt us because I understand he's a professional engineer. So now
Yes.
CUC doesn't have any PE.
No, but as soon as he put in his resignation, we put out the announcement. So the announcement for the JVA for his position has already been out. And in regards, if you are wondering about the executive director, it's been out also, and it's about closing next week for that.
So what is the, I guess, I just want to kind of know why is he resigning from CUC?
Oh, it's personal matter.
Personal matters? Because I asked that because the transition report, that's one of the things also that they discovered that there's a lot of these positions that need to be hired as far as engineers, technical people, and all of a sudden, we have two people, technical people that are out, and it's going to create more challenges. So, are you actively recruiting
Yes.
now? And
Yes. Yeah. The JVA is already out in the workforce.
all right. Okay, thank you, Mr. Chairman. That's it. Okay.
Thank you, Chairman Malonia. If there's none, I would like to thank you, Chairwoman Tenorio and Acting Executive Director Talai for your time today. And I hope that if there's anything that is being, if there's any decision made by next week that you share with the committee, and so that we can also further discuss how to address other issues moving forward and come up with a more permanent solution.
Will do, Chairman. And
Yeah.
thank you,
Thank you.
both chairs.
Thanks.
Thank you. This is Masi, and I'd like to also thank Senator Babauta for her initiative into looking at, whatever she's trying to do to also help resolve CHCC's matter, which would in turn benefit CHCC, CUC, and also to everybody on this body. Thank you.
Thank you, Acting Director. At this time, CEO Munya, to you as well. If I hope we get to hear from you by next week. If the decisions made by CUC is not in favor, it's unfavorable to CHCC or unrealistic, or and so we hope that we can continue this discussion so that we can try to address the bigger problem on a more permanent basis. And so, with that, thank you both agencies for your time today, and you are hereby excused from this committee. Thank you. Thank you, members. At this time, I'm not sure if I put a miscellaneous on the agenda, but if I didn't, any discussion by the members?
None.
None.
If not, can I?
Chairman, can we just have a committee of the whole if there's any such thing before we adjourn?
Okay.
Or if there's such a motion to committee of the whole, no? That of the
Yeah.
stuff.
Wonder miscellaneous. I guess you can bring it up. Oh, there's none.
Okay, hello, Sieta Fan.
Well, we're still technically under discussion in regards to the communication, so that's something that the members would like to further discuss.
Okay, so just very brief recess.
Yeah, recess, short recess. Now back from recess, and I think the members agreed that we will allow for CUC to conduct their meetings to address the what was discussed today, as well as consider the recommendations made by the members. And so at this time, we will adjourn today's meeting, and then over the weekend, I'll issue out the notice for a meeting on Wednesday, in hopes that they come up, CHCC and CUC comes up with a solution that is agreeable to each party. And so with that, can I get a motion for adjournment?
So moved.
A motion was made and seconded. All in favor, say aye. All opposed, say nay. Motion carries. Meeting is hereby adjourned at 5:07 p.m.